They call me super host Miss Kithinji, and I'm going to be moderating the live podcast today. Joining me on set, I'm going to introduce you guys. I'm going to say the names, but I'm going to let you guys tell us what you guys do. Okay, so this is filmmaker Enos, and we have Marianne as well, who is going to be our psychologist. Please introduce yourselves.
Okay.
Uh huh.
Ladies first. I
Okay.
start.
Okay, thank you very much. As stated, my name is Marianne Mugane. I'm a psychologist by profession, specifically clinical psychologist. I deal with mental health issues and just bringing people back into recovery where they have been having challenges.
Yeah. My name is Enos Alik, filmmaker, creative director from Nairobi, Kenya. Uh, I shoot movies, series, and anything just content related. Yeah.
Yeah. All right. Welcome, guys. Thank you for joining us.
Thank you.
Thank
We
you.
can't wait to share the story that you have and also
Yeah.
just Marianne to help us get into it even deeper. Guys, today we are going to be talking about mental wellness, how to just be okay mentally. And with us, Enos has been in the film industry, he has been a renowned producer. He still is, but not in front of the camera, like in the past. And
Yeah.
today we are going to be talking about differentiating or separating the creator from the creation.
Yeah.
Meaning, what is the difference between the artist and whatever they're producing, the content itself?
Yeah.
Because sometimes I feel like people are not able to differentiate, especially people who are out there, our
Yeah.
fans or people who get to consume our content. When they get to meet you, they might not know what's the difference between your content and you. But I want to hear from you, Enos.
Yeah.
Did you experience that separation where fans were able to differentiate you as a creator and creation?
Um, Sometimes I would say it's a very hard topic because I would say art is very deeply personal. Yeah. When you see an art piece, it kind of represents maybe what you're thinking at that particular time, your ideology or your worldview on a specific content that you're doing. It gets tricky because for me, when I'm doing, for example, I started out doing a lot of music videos. When I'm doing the music videos, what that video at that particular time represent doesn't necessarily represent what I am as a person. I view it as art, where I'm doing this video, I'm doing this Sauti Sol Nishike video. When I'm doing the video, it's very heavily like connected to what the songs, what these guys are singing about. They're singing about love. They're singing about a particular thing. They're singing about whatever thing they're singing about. That's what I represent with the art. Me personally, not really exactly what I'll do, and it gets tricky because people either think that's what you represent or that's what you're all about. But for me, I'm just approaching it in the form where I'm educating and I'm also entertaining people at that particular time. So it's been, even to what I do even up to now, it's been 50-50, where you get some people who know you personally, maybe they can separate. From other people, they they don't really figure it out.
Yeah.
But it's all good and it's art.
But how has that been for you? Were
Yeah.
you like able to tell these people, no, guys, this is separate from what I have created? I am a totally different person, or do you just engage them and you wish them well?
So something interesting happens when I'm working on a particular project. In the beginning, have to put my personality on it, either in terms of how I shoot or how I set up the scenes or just the creativity behind it. And I'm always very deeply involved in it. It's like it's my baby. But the moment it comes out, it gets to the world.
Yeah.
That's why I say, mtoto ako kwa, tumemwacha kwa dunia.
Yeah.
So when it gets out there, I have little or no control in terms of how you or any other person will perceive that particular art. So I always, that's why my approach is first put my personality in it, put my thought process in it. When it gets out to the world, it can, there's some people, and it's also down to how people perceive it, okay? There are people who will perceive it negatively. They'll be like, what is this? This doesn't make sense. There are people who would love it, and there are people who would just be like, "Hmm." So when it gets out, I don't have a lot of control in terms of how people perceive it. I just hope or wish like my taste in the shots, my taste in the costumes, my taste in how I edit, majority of the people will love it. But at that particular time, I have no control over it. And in a way, it affects also how I approach my particular content. Let me call it art. It affects that because when I'm creating the ideas and all that, I'm always in that constant fight of, am I going too over? Will I please the older people? Will my mom watch? will what will my neighbor think of me and all that? And it's always that battle where you're trying to balance it and that. But you sort of find ways, and the good thing is when I'm doing a music video, it has a different idea. I'm doing a different song, I'm doing a gospel song, I'm doing a movie, I'm doing a film. So you'd get at least people realize that I'm not only doing this kind of video, but I'm also doing this particular video, which is a gospel. I'm also doing a series, I'm doing a movie, I'm doing a TV commercial. And it gets to a point where now they realize, okay, this person is just creating art. Yeah, and they're just doing things related to what that particular content of film is related to, yeah.
Now we are gonna get a little deeper into that, but let
Yeah.
me talk to Miriam now. Miriam, when it gets to a point where now it's affecting the decision that you're making, the kind of content that he wants to put out there,
Yeah.
because again he wants to resonate with all this audience, but again the feedback is also very important. How do you go about that?
Yeah. Okay. I think first of all, it's important for him to consider what the audience wants to see, um, and also he wants to put the best out there. However, it's important then not to lean too much on one side, where you're just considering the audience completely and forgetting you. Yeah, because it can go to the point that now would call this in psychology, where you talk about you're just pleasing everyone else, not considering you and what is also important to you. Yeah, because that also can bring the aspect of conflict of values, maybe. Yeah, because it's not all the time that what the audience wants is what you feel all right to bring across, right? So is trying to find a balance. Yeah, so what is working for you, what is working for them, that helps both of you succeed.
Yeah.
Yeah, yeah,
Apart from now what's working for you and what's working for them,
yeah,
having to strike that balance. Maybe there are a few aspects that I need to check,
yeah,
so that
yeah,
I am able to strike that balance. Because
yeah,
sometimes there's a very thin line,
yeah, yeah.
What are some of those factors do I consider?
Okay, I think first you have to be very clear for yourself. What are those things that you can't compromise on, that for you, that are very important? Yeah, in as much as whatever is asked of you to deliver, because at the end of the day, you don't want to create internal conflict. You're delivering something, but then it is not even feeling so good to even deliver it, because it's going against so much of who you are. Yeah, so there has to be an establishment of, okay, in this product that I'm producing and putting across, yeah, for me, how will I, even if it succeeds, will I be happy with what I've put across as me, the individual? So being able to separate you, the person, from the product you're putting across, that's number one. And that will again tie together with the costs. Are you able to deal with the costs? Because the audience will speak. They will say whatever they'll speak. Like nowadays, people are not very kind. Yeah. So they may say very nasty things. And if you're already not happy with yourself because of what you produced, and then nasty things are said, see now that it's like, you're losing twice. Yeah, yeah. So there has to be space for both. Yeah. Where are you compromising? To what level are you compromising? And at the end of the day, who are you as a person who's producing this product? Yeah, for the people that you want to please, yeah, to see your art. Yeah, yeah.
So maybe Enos. All right, so Enos, maybe you could tell us if there's a certain scenario that you can point out, that actually happened that led you to feel like, no way, I have to change this. A specific scenario that you can remember.
Okay. Whether good or bad.
Yeah.
So, because I come from a very big background of music, yeah, from my family and also how I grew up. So it was an easier transition when I was doing like music videos, when I was getting into the industry, and I was waiting to get to university and all that. So every single like video I was doing, I would really sit down, listen to the music and all that, and also represent my art in a way. So I did a couple of videos, and I think it's just my nature. Even in the beginning, I was very bold. Yeah, even when I was creating ideas for videos, I did a lot of videos which are very controversial. Yeah, controversial in a way because maybe they were bold. But again, for me, my approach was always, I'm entertaining and I'm educating and I'm also just being true to myself. We do our Nishike video, did a video with Octopizzo called Evo Evo. Yeah, so those are like videos that they are really, they got banned like the next day. Released today, the next day, banned. Why? Because maybe they're talking, people aren't that bold in expressing themselves. They get Sauti Sol Nishike video. It was very, I don't think it was crazy, yeah, at that time, but, and I think that's the time the cancel culture was coming in. Yeah, no, you guys do music that it's for everyone. Why are you guys now doing very mature kind of content and all that? But they're also growing in the step. Same with even Octopizzo and all that. So after doing that, those videos, of course, they get banned. That's when they blow up and become even bigger. People now want to see what is that is being banned. Then you watch it and you're like, not really. It's actually good. Even right now, if I watch them, like all this, like almost 8 years after I've done them, I watch it and I'm like, they kind of represented their growth and what they're doing. But immediately after that, I was always thinking, and I'm just trying to figure out, maybe do I really need to tone down on the boldness, or what does it represent to me? Do I want to go to a place and people are like, are you the person who is just doing bold videos or crazy videos? But in a way, what I felt that particular time, people appreciated the art. Yeah, you're not just going bold because you want to go bold and you want maybe the videos to be banned or all that. We're going bold because the art and the music at that particular time represented what the artist wanted to do with their growth, and also what I wanted to represent as a growth of also what we are doing. Yeah. And in a way, it shaped a lot of perception on how people are approaching videos, on how people are perceiving the growth of the artists, and generally it ended up being a good thing. But after those videos, I was really I have an idea. I'm like, maybe this is too bold. Just tone it down. And there's always that fight. Yeah. And something that I really fought around with. But at the end, I appreciated it, and I was happy that it's something that we did. Yeah.
Do you feel that making these bold decisions also come with age? The younger you are, the more bolder you are, and the older you get?
I guess so, because it's, again, as I said, and it's true, art it's very personal. You're deeply connected to it. When I'm there, that time, I don't know, I was in my early 20s, and I started very young. Yeah, immediately after high school, I was there just shooting videos and all that. I was not carefree, but I had this like burst of ideas, and I'm like, I have to do it. And you're bold because there's not a lot of thinking. Yeah, you're not going to think, what did that person think about me? I'm like, no, me, I want to represent my art. Yeah, but when you get older, the balance becomes better, where you figure out, okay, it's too bold, but I also have a client. It's not I'm doing a video for an artist, like
Yeah.
it's Ali Kiba or whoever. I'm like, I have to balance also. They have a brand. Also, for me, I'm depicting something. I treat them as my client. So I have to sit down with them and also figure out, what do you want to represent with this particular song, or if it's an advert, or and also did a couple of adverts which got a lot of talk, and I've done a lot of them. But you always sit down and figure out, right now is, what's the balance? What do you want as a client to represent you? And are you willing to go bold? And if they say yes, immediately just turn the volume of boldness. So
Yeah.
you get to have that balance when you grow older.
Yeah. Now, Marianne, from a psychologist point of view, do you think some of these bold decisions and just not caring what people will think a lot comes with age or not?
I think it comes with age.
Uh-huh.
Yeah, and I think it depends again on what the subject is. Okay, because they also say if you're above 40, yeah, you become very independent, and you are not very held by what people um, feel, yeah, you should be thinking or doing, yeah. But also in your 20s, because it's like the world is yours, yeah. So you want to go full throttle. So, and at the age of between, well, as one is moving from teenagehood all the way to um, the early adulthood, you're trying to define yourself. You're trying to figure a few things, and some things also are very interesting to do. So you want to, do the maximum, yeah. So you find a lot of people take risks during that time, yeah, because they can. And what are the costs really? Yeah, yeah. And that time you're single, maybe you don't have a family, so you can have, the costs,
Yeah.
whatever it is. So I think age and phases, yeah, yeah. Because the older you get, also, there is the cost implication, there is the reputation,
Yeah.
you have your family. What will that do to the family if you become too bold and people don't like what's happening? You see? So, yeah. So I agree with him when he says about balance, but I also feel it's also with regards to what is the subject. Yeah, yeah, yeah. Of that is being expressed with boldness.
Yeah. I also feel like at a point in life when I was younger, there are pictures I would take and post on social media. But as I grew older, I feel like, no. I don't think
Yeah.
I can post this picture. It doesn't represent who I am now,
Yeah.
But I was very much okay at the time when I was posting previously. I was wondering what was happening.
Yeah.
Yeah.
Beauty of growth.
Yes,
Yeah.
for sure. So let's talk about Enos. Now when you decided to transition, let me
Yeah.
call it transition,
Yeah.
from now music directing
Yeah.
and now having your name on all these music videos,
Yeah.
working with these renowned artists.
Yeah.
Did you just decide in one day, like, I am no longer doing this?
Yeah.
And how was that process for you?
Of course, it wasn't in like one day, but immediately when I got in the music industry, I always had this vision where I just feel like it needs to transition like into a different phase. Most of the people I used to love their works as music video directors and all that. Most of them are always just transitioning into movies. And these are the biggest movies you're seeing around. And I had this love of film and theater because I was very actively involved in drama when I was in high school. So as I was doing the music and all that, I sort of realized that this is a creative space. With anything creative space, I think there's always like phases and waves where there's a time you're creative, there's a time you're not, there's a time you're creative and all that. So I figured out maybe you need to expand growth, maybe you need to grow. And this was in the earlier stages. Immediately I started like doing videos.
Oh,
So, yes, so I would go and learn and maybe see to like industry guys who are doing like TV commercials, because that's the next place I went to. So I'd also feel, and also most of the reason was also because there were seasons of like music, okay?
Yes.
You'd get in January, like guys were releasing a lot of music, funny enough. In January, people are also trying to match them up when schools were closing. So after maybe the second term, that's the time people are releasing music, or when people are at school. So there are phases. So you'd get places where for a long time, a month or two, there's nothing much happening, because every artist will follow a different pattern. So I figured out, maybe, and also just to survive in this Nairobi, you need to figure out something else. So that's why I made a decision. Let me transition into like other forms of this particular art, and I got into doing a lot of TV commercials, consulting, and it was different because at this particular time, when I'm doing a TV commercial, I am not putting my name there, like directed by, you can't, but you're doing a lot of content, you're doing a lot of art and videos where now you're dealing with clients who are very particular on particular things. If you're doing Safaricom, the green, I cannot just have any green. It has to be the Safaricom green. So everything is very particular and all that. And it sort of just gradually got into this particular thing. It was a learning process. You're letting go of a lot of things, a lot of privileges that you're having maybe when you're creating your art, because now it's a collaborative process. I can't just decide we're doing this advert upside down. I'll do that on a music video. I'll say the whole music video will be upside down and black and white. And people will be like, that's creative. But here now it's a collaborative process. You have to figure it out. So I just slowly got into that.
But how was that for you mentally? Because now you see you're getting into this new space. You're creating new networks. I mean, there are a few of them that were probably in the same industry, but you're still creating new networks. You were used to be, the top shot, like, guys, we're doing this, it's black and white. And they're like, it goes. The director has said, but this is collaboration. How was that for you now, mentally, just taking up?
I think it was hard. Okay, I don't want to say I'm very tough, but and I think I got that from the music industry, because from the music industry, you get your response or your feedback instant. Like you release your video instantly and people don't care. People are like, what is this? You're wasting this artist. So you had to have like a thick skin where like maybe a lot of feedback, you get it, pick the good ones that you want, the rest. I got that from the music industry. So now here I am doing TV commercials, maybe big brands and all that. And you get there and you're trying to pitch. The first thing people, when you get into that room, or when you're pitching or when you're on set and trying to direct, and people say it, you get, Joy, you saw music video? You get it? So you're constantly fighting that, because maybe they've seen a lot of your work from the music video, because a lot of people watch music. So most probably you'll get to interact with maybe a name or so, or a particular producer. So when I'm getting to these other forms of art, people in a way thought that maybe these things are different. Like how we approach a music video is different to how we approach an advert, different on how we approach a film. So in a way, as you're saying, there you decide. Whatever you say goes. But when you come here is, whatever you say, it's taking into a very high consideration, but there's a lot of things. You have to deal with the agency, also the client. They have to also put what they feel is right for their brand there. So I was fighting with a lot of, this is not a music video. Is your car music video? You have to take that in, not in a bad way. Some of them will say it maybe in a light way, and they'll like maybe you have to approach it differently. But in my head, I'm like, it's the same thing. You get it? It's like presenting in a crowd of 1,000 people, a crowd of 2 people. It's the same. It's the same thing. So at the very, very, very first time, I would catch. I'm like, what do you think?
Yeah.
But I'd always, for all the projects that I was doing at that time, and I think that was the beauty of it. And I realized later, because I have this background of music, so when I'm doing my advert, whatever I learned from there, when I put it into this advert or something that I'm doing, there's always something different. And now that became something very unique. So it stopped being kukach into now. By the way, that's what makes me unique, because I have that background. So I use that as something that for me I know, and always approach, even if you're doing a movie, even if you're doing a series, all of the movies and series that I'm doing are always very heavily on music, and even supporting very young upcoming artists. And that is something that I learned from it in a positive way. Yeah.
Now, Marianne, you probably understand the situation that Enos was at that time.
Yeah.
Trying to create new networks, trying to deal with new people, having to accept that this is different. I mean,
Yeah.
we know you're dope, but you have to listen to this opinion as well. Maybe you could just let us know what was going on at the time now mentally for him.
Okay, just by listening to him, what is coming out is that it was a process for him. We normally say we don't know what we have until we don't have it. And most of the time when we are transitioning, we'll feel like we have moved from one maybe role to another, but there are so many other smaller things that are connected to that previous role of what you are doing that you may not have in your awareness. Then now you come into a new environment and you're doing your thing. And then you discover this environment is different, yeah? And now you're being asked to reconsider how you are doing, like sort of break away from what you are doing. So it's also calling for to relearn, to learn the new environment, then to adjust to it, and then to be okay in that new environment and what is being asked of you. So there are some things that, as he said, catch, because there's an emotional aspect.
Exactly.
He's doing
Yeah.
something, the way he's describing it, something he likes, and he's
Yeah.
loving it. But then he's being told, hey, tone down here, tone down there.
Yeah.
You know, it's not easy to be told to tone down.
Especially when you've been good at your area.
Yeah.
It is not easy, So it's now adjusting, and then now finding your footing into now that new space.
Yeah.
Yeah, and then now after finding your footing, then also now finding what works for you. So you see, it's a process. And sometimes for some people it may be difficult, because you're like, hey, why is it this is a no, this is a no, this is a no, when I was there, hey, if I was doing this alone, it would
Yeah.
have gone through. So also they could be second guessing maybe.
Yeah.
Yeah. I, where they saying no? Is what I'm producing not good enough for this environment? So there could have been some negative evaluation of self or thoughts,
Yeah.
even evaluation of the environment, even what they are saying. Yeah. But it's both mental and emotional process that comes to a place finally where you adjust into your new environment and then find what works for you and for them also. Yeah. So for some people, adjustment takes even up to 6 months. Some depending on the environment, some people it can take up to 1 year. Okay, and also depending on what is being done there, in the pace in which your work is being demanded of. Yeah, so also environment matters, pace, expectations, yeah, and then your personality. Are you flexible? Yeah, yeah.
Okay. Now, Enos, let's call it life after fame, because now your name is not being put up on these commercials. You're doing great things, but we don't know it's you.
Yeah.
Is there a case scenario where now you're in this place, you have to introduce yourself afresh, and you're like, come on, guys, you cannot say you do not know me. Was there a place that happened?
Maybe yes or no. So even when I was doing like a lot of music videos and all that, even up to today, because I started like about 8 years ago or something, even up to today, there are guys who have never seen me.
Okay.
Yes, they know.
They've
Maybe
never
they.
put her face on the name.
Yes, but they've watched videos where I've put my name there. And sometimes when I get just to say my name, also in a way my name is unique.
Yes.
So a lot of people don't believe it's actually my real name. My real name. So when I say it, people, I've seen this name somewhere. I was lucky. Most of the videos I did got a lot of like traction
Yeah.
and viewership and all that. So from, what am I saying? From when I was starting, I loved being behind the scenes. Even at that particular time, like even when these songs are hitting and all that, you just know the name, but you don't know this particular person. I don't know, maybe when I was starting out, I was shy. I would run away from interviews. I would just hide, and I loved it being like that. So even up to now, if you get to a place where you're doing something and I introduce myself or my name, I'm actually not expecting you to, like, do you know my name? Do you know me? And all that. If I'm pitching something for the first time and maybe you're pitching with different people, and I pitch and maybe the first reaction is like, I know this name and all that, I get happy because I'm like, maybe I have an upper hand when I'm pitching this. But most of the time I feel like even just being behind that, it's better for me because I prefer my work to just speak for itself and all that. But there's always that thing where when you're presenting, you're like, maybe somebody knows me here, or maybe they know this name and they didn't like this video that you did. So how is it going to affect the pitch that we're having? But you sort of flow with it, yeah.
Yeah. Now, Marianne, as we wind up,
Yeah.
looking at Enos' situation, whereby he decided he's gonna be a little bit behind her because he was still behind the scenes, but he decided he's gonna be a little bit
Even
behind
more.
her. You know?
Yeah.
How would you look at that situation, and how would you tell someone who is probably trying to transition in the same situation?
Yeah.
What would you tell them that they should factor in?
Yeah.
These are the things that you might go through,
Yeah.
and this is what you should do.
Okay. First, they need to be clear why they want to transition. Yeah. That is very important. And then what are they transitioning to? Yeah. And what circumstances are causing that transition? Okay. Because then that helps with preparedness. Yeah. The preparedness of there will be a lifestyle change, perhaps. Yeah. There will be maybe people who will drop you because maybe what connected you with them was whatever that was that you are doing. Yeah, you see. And then also the the, the costs that may come with that transition. Okay. And who are you transitioning with? Is it by yourself? Do you have other people that you are transitioning with? Yeah. And who are you to these people? So, like, let's say if you're a head of a family and you are the one who has been in fame, and now the whole family has to transition. Let's look at President Obama, how he had to transition. Yes. And so there are many things to consider, right? But what is most important is to be aware that there will be emotional, yeah, changes that will happen in that one because there are things you're dropping, there are things you're taking up. There will be adjustments needed, yeah, whether at the social circle, yeah, lifestyle change, financial even maybe, yeah, and also even time. So it's more of being prepared for the worst, yeah, and taking active steps slowly, yeah. But I'll also say also therapy may help with that transition because you never know how hard a transition can be until you're in it, yeah. And especially if let's say maybe you're transitioning not out of choice. You see, maybe something you loved and you have to transition and it was not up to you to transition, so there you are losing. So that may push you into grief, yeah. And if it's sudden, that can be very devastating. Yeah. So we say there is a need for support. Yeah. And therapy may be fantastic with regarding to that. Yeah, that transition. Yeah.
Because I've actually just looked at it in a way that Enos is lucky.
Yeah.
The kind of transition he was doing, he already knew what he was gonna do.
Yeah.
He already had the
Yeah.
connections, and it was out of choice.
Yes.
It was not a forced transition. But we know creatives, we know people that have been forced to stop what they're doing because maybe the audience is no longer consuming whatever they are putting out there, or even maybe new creatives are born every day, so they've switched to consume someone else.
Yeah.
How does that person now go about it? Because it's
Yeah.
different from what Enos is
Yeah.
doing, because now it's deeper.
Yeah, and I think actually, I hope the creatives do have the preparedness before they enter into the industry, because if you know that one day you may not be relevant, yeah, and you're working with that preparedness that one day I may not be relevant, then maybe you are preparing towards it.
Trust me,
Yeah.
sometimes
Yeah.
you just do a video
Yeah.
and you trend
Yeah.
and you become famous. You were not prepared.
Yeah.
People are following you.
Yeah.
You didn't even know. Let's say, for instance, we have this Gen Z Golia.
Yeah, yeah.
I mean, he's been tall his entire life. But look at him now. He's famous.
Yeah.
You know,
Yeah.
his height is not something new.
Yeah.
But now he's famous.
Yeah.
So sometimes you're not prepared. So what happens?
Yeah, so okay, the truth of the matter is anything that hits you quickly, it's gonna have an impact. Yeah, and depending on how you are also taken out.
Yeah.
Yeah, because with creatives, maybe you are called and told, you're not having this role or whatever it is, or is it something that was said on social media, and maybe you're trolled or that sort of thing. Okay, so the impact can be devastating, especially if you love what you do, and you're just taken out. That's a loss. Yeah, so I would say therapy would help, yeah, just to help this person find footing. Because it's like, let me use a car on the highway. Let's say if you're driving 100 kilometers per hour, yeah, there's no way you can put emergency brakes and that car will stop steadily just like that. If you do that, there'll be an accident, right? Yeah, and that's what happens internally. Yeah, there will be that negative repercussions with this person. Okay, so there would be need for a lot of support for this person. So a circle, social support. Yeah, so conversations of what is the next thing that you can do. Yeah. I've mentioned therapy, but also I would really urge artists also, even as you're in your role, on purpose, work on differentiating yourself from what you do. Because you are who you are and there is what you do. Okay? So that if you lose what you do, you don't lose yourself with what you do. You get what I'm saying? Because that's where some people say life has ended because, there is no meaning, yeah? But if there is that separation, then you're able also to check, okay, what else can I do? Even though I've lost this one thing that I enjoy, what other things do I enjoy that I can now start working to help me get up? Yeah, but social support is so important. Yeah, and that's dividing of self from what you do, because we are not what we do. That's a rule. Yeah, we are not what we produce. Yeah. So even though you're in the limelight and you have to have this persona and this brand, but who is your authentic self? You get what I mean? Because there is the brand you want the consumer to see, but that's not you. Yeah. So who is authentic you? So if you're aware of that, if these sudden things come, you can be quickly able to gather yourself and see what to do with support. If support is necessary.
Yeah.
Yeah.
All right.
Yeah.
I get it. Now, I know it's your last words in regards to Mindfest 2024 to someone who resonates with your story?
Yeah.
Please say something to them.
Um, just keep on doing what you're doing. But, and I think platforms like, and you were having this discussion even before we started rolling, I think platforms like this right now are very important because everybody is going through what they're going through. Yeah, we have our new, I always call it the new form media, where we're having our social media, where we're having, it's a cancel culture, which I personally believe people rush to judgment very fast because you have somebody who has a body of work which is very good. They do something either wrong or good or whatever, then people just rush into canceling them. And in a way, it really affects them after that in terms of how they approach their art, their content, and all that. People always rush to judgment. And I like what you're saying. Something which comes first, there's instant repercussions, yeah, to it. But how do you then navigate this particular form or role that you have? And I always feel like just being true to yourself, being true to your belief, being true to what you're doing. And I always tell everybody who's around me, just do your best. Okay. If I'm doing this particular art, we have example of people like Van Gogh. You guys, yeah, know Van Gogh, yeah. He was suffering from a lot of mental health issues, but it did not like diminish or like reduce his works.
Yeah.
His works are being like, people are celebrating his works up to now, but he was suffering a lot mentally, depression and all that. But if you see his pictures,
Yeah.
they're very bright, they're happy, even how they're named as A Starry Night. And these are artworks that are selling for millions and millions. Because regardless of whatever you're going through, when you're true to yourself and you're creating your art, you can create an art which represents what you're feeling at that particular time, or something different, or the art might be something to get you out of your mental well-being. But I always say, regardless of whatever is happening, just make sure whatever you're outputting there has to be the best. Either if it's dark or it's happy, it has to be the best. Yeah. And that's just the motto that I go with every day. Just do your best regardless of whatever is happening. If it's a hard time, let the hard time be the best of you at that particular time. If it's a happy time, let that represent that. And I think there are phases. Yeah, there are always some times where you're low, there are times you're high and all that. So always just approach it in a way that it's a phase, okay? I just have to go a couple of days to get through this low time. I'm going to a couple of hours, then I get into the happy time. So if you approach it like that, and if you're somebody who's doing what I'm doing, then you can always just have that positivity in you. And that's all I can say.
All right.
Yeah.
All right. Thank you very much, Enos. Thank you very much, Marianne. What I've gotten from this is, in case you're going through this, one, you need to learn how to balance from public opinion and what you want. You also need to relearn if you're already in a new industry or you've already transitioned. And at the same time, you need to be clear before you transition so that you don't suffer. It's very important. All right. Thank you very much, guys, for sharing this conversation and just being very insightful. All right, guys, I hope you guys have learned something when it comes to differentiating or separating the creator and the creation. Thank you very much for watching this session. My name is Miss Kithinji. I was joined by Enos and Marianne. Thank you. Hi everyone, welcome to yet another session at the Mindfest 2024 podcast sessions. Now today I am joined by Dr.
Bundi.
and all right, so guys, we're going to be talking about trauma, childhood trauma that relates to reproductive health issues. Personally, when I saw this, I was like, what? There's actually a relationship? And my two guests here, one is a psychologist or rather a doctor who is going to be informing us more about these health issues. And then Corazon Kwamboka is going to be sharing her live experiences. Yeah? So let's get into it. Corazon, did you ever think that you have childhood trauma?
No.
No?
No.
At all, at all. Uh-huh. Now let's also now talk about the reproductive health issues, things like PCOS, endo,
Yeah.
infertility. Which one can you relate to? There?
Fibroids and endometriosis.
Endometriosis. All right. Now, before we get into you giving us your live experience, or rather your experience with these health issues, let's talk to Dr. Vundu, who is going to explain to us what PCOS is, what endo is, and what do we mean with by infertility? Because I mean, sometimes you know it's infertility, but do you really know what it is?
Yeah.
So
yeah.
maybe we can start from there.
All right. So I'll start off by saying that I'm a psychiatrist.
Yes.
And then my special interest is women's psychiatry, women's mental health.
Okay.
Because I've realized that these issues, PCOS, infertility, even postpartum depression, your hormones are connected to your mind. You can't separate the two.
Okay.
So I'm studying on how those two work together. So if I was to go by the definitions, of course I'm not a gynae, but I do understand that infertility is whereby a woman or a man, in the process of trying to conceive, you're not able to conceive for about a year, and we have excluded, we've made some certain exclusions. So that's for infertility.
Hold on. So you're supposed to try for 1 year?
Yes, so when you go to a gynae and you tell him or her, I'm struggling to conceive, they'll ask you for how long. If it has been 3 months, they'll tell you
To keep
try.
trying.
I don't know if that's your experience.
Uh-huh.
Yeah, they'll tell you to keep trying for about a year.
Yeah.
Then now after that year is when they'll say, okay, fine, now we're dealing with infertility. Because guess what? So many things affect fertility, even stress.
Very true.
Things like stress can affect fertility, weight. So in that 1 year, the doctor will also tell you what you can do to make sure that you get to your goal of having a child. Let's talk now about endometriosis, and I'm sure you'll chime in. So it's a condition whereby, you know the tissue that's inside your uterus?
Yeah.
It starts growing outside the uterus.
The uterine wall?
Exactly.
Yeah.
Okay.
So it's supposed to be inside the uterine wall, but now it's going to the ovary. Some people, you find it goes to the lungs. It can be so serious as to go to the brains. And of course, if something is where it's not supposed to be, there'll be pain.
problem.
It's a problem. So some of the symptoms, and maybe you can chime in, is pain.
Yes.
Pain, because something is growing where it's not supposed to be. And lastly, PCOS is a whole syndrome, but within the syndrome, we have things called cysts, like
Yes.
balls of fluid, yeah? And they tend to grow in the ovaries. But it comes with other issues such as weight issues. You have a slow metabolism. Some women with PCOS have hair where you're not supposed to have hair, like in your chin. So it's a whole syndrome.
Uh-huh. Let's talk about endo, because personally, there's a time I mean I've grown up with a lot of painful cramps, like really painful cramps, and at some point I thought I had endo. So where do you draw the line? Like pain that is actually just cramps and endo. Where do you draw the line?
That's a beautiful question, and I want to speak directly to all the women who are watching this, who experience period pain. Don't gaslight yourself. If you are in pain, go and see a doctor. So it's not your job to diagnose yourself, right? But the point is, when you're feeling pain, go and tell the doctor. This pain, I don't think it's normal. Can you check? what tends to happen in our society is vumilia.
Yes.
And there are some myths out there, like if you don't vumilia, you won't vumilia childbirth. So a lot of women are just toughing it out. In high school, you go to the nurse, my period pain is too much. They're like, you're being dramatic. So to answer your question, if you have a lot of pain, go see your gyna.
Yeah. What are some of these myths? Because you've mentioned one where you're
Yeah.
being dramatic, hautavumilia, kuzaa. What are some of other myths that people have out there for someone who is watching and they feel like, okay, I have a lot of pain, but I've been told this and this and that, so I should not gaslight myself. What are some of those?
I'll just give one more myth. I feel like this one is pretty common. A lot of women fear to go to the doctor because they think if you go see the doctor, the treatment will be something scary. Like you'll be put on birth control, or now I'll need, so a lot of women are just scared of, when I go to see the doctor, it will be something I'm not ready for.
Yeah.
So fear. But then there's also, in the converse, and again in our culture, a lot of women think that you have a lot of pain because you did something to your body. You had an abortion. So there are many young girls who are not telling their moms.
Because they are afraid.
Yes, there's this myth, I don't know where people got this from, that, or infections, like if you have painful periods, nikitulijiletea. For a non-Swahili speaking audience, it's something you did. You must have done something like an STI.
You're the cause.
You're the cause, or an abortion, or so a lot of women are suffering in silence.
Yeah.
So those are just some of the myths that I've encountered.
Yeah.
Yeah.
Can I tell you something? Actually, when I went to the doctor,
Yeah.
he recommended the family planning. It's called what? What do we call
It
them?
is one of the ways to
Yeah.
treat endo, actually. Like when I went in to see the doctor, the first step I did was they advised me to take that, and I said no, and then
Yeah.
they put me on induced menopause.
Uh-huh.
So I think that's also one of the ways. It basically just stops your period for some time, so then the tissue doesn't like keep growing.
But
I
is
don't
that
know,
a
you can-
good thing?
So and I like that you've said, maybe I can ask you, why did you feel you said no to the birth
Basically,
control?
like during that time, because I wasn't really aware of what was happening in my body, I was gaining a lot of weight because of the endo. So my belly was always, and everybody
Bloated.
told me that family planning is going to make it worse. Contraceptives is going to make it worse. So I told my doctor, like, I'm not trying to gain any more weight than I've already gained. So put me on something different.
So wonderful. So you asked me whether it's a good thing, and a lot of
Yeah.
women fear birth control.
Because I also said no. And the
Yeah,
reason is
yeah.
because I was very young. I was like 22. And
Yeah.
my elder sister said no.
Okay.
Yeah.
So that's the thing. I think it is a treatment, even for PCOS, even for a mental condition called PMS or PMDD, whereby you go through a lot of mental issues during your cycle. They do recommend birth control, and there is nothing dangerous about it, but it's very particular for the patient. So you see, for her, she was worried about weight, but there are also some birth control that don't cause weight gain.
But the reason why I specifically said no is because I think the birth control they use is the hormonal ones,
I see.
because then it's like hormone related.
Exactly.
Yeah.
So I would say, if you're scared, ask your doctor to educate you. I'm sure your doctor must have sat down with you and told you, this is how it
I
is.
wasn't hearing it.
But yeah, the fear is there for birth control, but there are other options. I also don't like doctors who force, you must use this birth
Yeah.
control.
Yeah.
If you notice somebody's not comfortable, just give them
Just
an
let-
alternative.
Because for me, we ended up now, the doctor said you need to start taking painkillers days before your period so that you can tame the pain. Yeah, that's what I have done that my whole life.
So, but luckily for you, you don't have endometriosis.
As I grew older, it's less painful. Yeah, it's less painful.
So I think that's also one of the things, like there are people that suffer from, but you've already touched on it, there are people that suffer from painful periods. So when you have endometriosis and you're like in pain, someone will think, you just have painful periods, like nothing to worry about. My sister
Yeah.
had painful periods, but she didn't have endometriosis. So I think it's just one of the symptoms, but again, as you said, it's not in our place to diagnose ourselves.
Yeah. So Corazon, at what point did you now realize this is endometriosis and I need to seek help?
So I had this issue since high school. So at some point, I think it was by chance that I found out I wouldn't have. All I know is during my life, I had, experiences where I could have probably gotten pregnant, but I never got pregnant, ever. Like, mi sijawahi kuwa na hiyo shida in my life. So one time I got sick and my belly was really hurting. So I thought I had H. pylori. So I go to Nairobi Hospital and they tell me, you need to do a scan. What is it called? Ultrasound.
Sorry.
So I do the ultrasound and the lady's like, wait, you don't have any ulcers, but we see something here.
Yeah.
Should we give it time?
No, it's okay. Just continue, yeah.
So she says, we see something here, like you have endometriosis. So then I start to look for help, and then only to go to further ultrasounds and find out that I had two. So it was by chance. It wasn't something that I thought, okay, I need to see a doctor for my painful periods.
Yeah. So did you even understand what was happening at the time, and how was that reaction for you?
No, that's the moment when I started to do my research on endometriosis and all that. And then I remembered my mom telling me when I was a bit younger that, these painful periods might make you infertile. So I'm sure she didn't really understand, but she knew that painful periods is related to infertility. She didn't understand it's because of the endometriosis. So she told me, go and see a doctor. So that's when it hit me that actually I've never been pregnant, ever. And I did my research, went to different doctors, eventually found one that I felt comfortable with, and
And how was your reaction now, mentally? Because I think you were younger. Was it, that's fine, we're going to work through it? Or how did you receive the news?
I didn't really, all I cared about, I wasn't even young, I was 28.
Oh, okay.
Yeah. But all I cared about at that moment was whatever is in me and it's not supposed to be there, just get it out. I want to continue with my life. I want my periods to be better, but yeah.
Now, what support did you get from your parents at that time?
My mom was there with me. I did the surgery. The surgery, luckily, is not really that invasive, for most people at least. So, laparoscopy, so they did like little scars here and here and here, and an hour later, I came out. Actually went back home the same day. So really, it wasn't something that was a bad surgery. And then in 2 weeks, I was back to normal.
Back to normal.
Yeah.
Now, Doc, Corazon's situation is probably different from someone else who has always wanted a child. And then now, there's news over here. There's something going on. So you become devastated. You don't know where to start. You don't even know if this is something that is going to work anymore. How are you able to get into this situation and come out of it?
Yeah, I think that's a brilliant question, and it points towards how endo, PCOS, infertility, all those, yes, they are gynecological issues, but they have a big psychological impact. It's like one of those diagnoses you get and it does something to you. So we love that you're resilient and you had a lot of support, but there are a lot of women who one, don't have support, maybe even they don't have insurance, they don't have the funds to do this treatment, surgery. Then they don't have, for example, we know research shows that women with PCOS and endometriosis are more likely to get depression and anxiety. So now this woman doesn't have the support, doesn't have the funds, she's depressed, she's anxious. That's a recipe. That's a recipe for a lot of stress and depression. So it's what I would say is, even for the doctors who might be watching this, when you give somebody a diagnosis like that, please connect them with a therapist. You don't just give some people diagnosis, even something like cancer, and then you just say, okay, this is the plan, chemotherapy, bye. You need a counselor to walk with you the journey of, okay, if I'm infertile, what does this mean? So for me, I highly recommend that as we are doing the physical treatments, the surgeries, the hormonal therapy, please get into therapy, and even with your partner. Even with your partner, because if your partner is hearing you might be infertile, what does that mean? What does that mean? And men are allowed to have these feelings. So I think as opposed to you guys going home to fight about it, get into therapy and let the guy say, okay, so what do we do? This is my expectation, you know? So I highly, highly advocate for therapy. Yeah.
What's the connection? I know all these are reproductive health issues, but what's the connection between PCOS and infertility?
Okay, so all these conditions are hormonal, right? And for a woman, your hormonal system is very much connected to something we call, I don't want to get too medical, so I don't
Okay.
lose you, but there's something called a HPA axis.
Okay.
Let's call it the stress axis.
Okay.
Okay, it connects your mind and your body. So anything that stresses you wakes up that HPA axis. So these conditions, right, these hormonal conditions wake up the HPA axis. So basically, it just sends your mind a signal, we are stressed,
Just because of the hormones.
just because of the condition itself. So because of the way the hormones are acting up, your mind now is like fight or flight. Now we are fighting.
Yeah.
So what does this mean? When you have chronic stress, it can affect your sleep, your moods. When this HPA axis is alert like this, it makes you even more prone to pain. So the way that somebody with endo perceives pain is very different from the
And
rest
normal-
of us. You're receiving that pain like times 10. So you're inflamed, yeah?
All the
Yeah.
time.
All the time. So that is the connection. And I'll even go a step further to say that women who have these hormonal issues, you know, yes, your HPA axis is alert, but I think that even when you're treated, it remains alert.
That's why even after surgery, some women, it takes them years
Yes.
to be able to conceive.
Yes, and even to be able to be calm, to regulate your emotions.
Yeah.
So we've done the surgery, right? But somehow you're always just stressed, anxious.
And
Exactly.
I go through that a lot.
Wow.
And I didn't understand until our conversation earlier that all my life I've been called feisty corazon. Like I'm always like you say something small, I'm already triggered. But I didn't know that, my ups and downs in my moods was something that, I didn't have control. I thought it was just my personality. I didn't know it's something that I could,
Let
sort
me
out.
validate
For,
you.
Yeah.
Please let me validate you. You're not dramatic. You're literally like fight or flight all the time. You're always on fight or
yes,
flight.
exactly.
Yeah. So I think it's really important to validate these women.
Yeah.
It's really important to validate them because you can even start thinking, am I going crazy? Am I okay? Like, why is something like this making me react like?
So triggered. Yeah. And then like even maintaining relationships with people becomes hard
Yes.
because your hormones are always. I saw somewhere that the estrogen level is high.
Absolutely.
So it's like you are always on, the way women feel when they're on their period. You are like that every.
All the time.
All the time.
Yes.
Now they say you have a character problem.
I'm telling you.
Oh my. And then at what point, Corazon, now when let's say now you're done with surgery, yeah? You know you're okay. Did you want to have kids immediately or did you just wait?
Okay, so what happened is, so for me when I was doing the surgery, kids was not like part
priority.
of. Yeah, it wasn't. So that's why I think maybe it didn't even affect me that much because it was like, I'm not thinking about kids. I don't even, I feel like for women who actually want kids, it will be more stressful to them to find out that they had. So for me, it just happened like, did my surgery in January, and then in December, I was with my mom, and she says, I think you're pregnant. You look pregnant. Or
Really?
whatever you're telling me you're going through, seems like you're pregnant. I was only 4 weeks pregnant, so it was something that came as a surprise. But when I found out, I was like, being that I'm an endo warrior, maybe this is my only chance, so
Let's go with it.
let's go. Yeah.
Yeah.
So I was happy.
So were you worried? Now you're 4 weeks pregnant, you just found out. Looking back at the situation where you've been, were you worried?
I wasn't, I think because of the support that I always have with my mom, because the first thing my mom told me was like, I'm going to have a baby, and she said, just have the baby and give it to me, I'll take care of the baby. And when I called my doctor was like, good news, perfect news, because he told me that having a baby actually reduces the chances of the endo reoccurring. So I was like, okay, so this is a win-win situation. The only thing that worried me a little bit is, breaking the news, because the person that I was having a baby with, we were not married. We were not even in a real relationship.
Official, yeah.
Yeah, official relationship. But before I broke the news, I just told myself, I'm going to break it. But I know one thing for sure. I'm an endo warrior. God has blessed me with this miraculous pregnancy.
Yeah.
I'm keeping it, whether I'm going to do it alone or with someone else.
Yeah. Now, Doc, as an endo warrior, you're now pregnant. Are there any specific things that you should do? Are there any precautions you should take?
I think from the mental aspect, like she has said, I think it's very good to communicate with everybody around you, because we can continue to see the mood fluctuations in pregnancy. So women who have endo, PCOS, any hormonal issues will be at risk of getting what we call perinatal depression. So this is depression during pregnancy or after, what we call postpartum depression.
Yeah.
You're more likely to get it. So that's a time now to get in check with your therapist, to walk the journey with them. And of course, to just do the appointments. Just do the appointments. But it's not likely to recur when you're pregnant. It may recur after. It may recur after. But during, in fact, it's like a blessing. When you have endo and you're pregnant, it's like you're cushioned a little bit. But the mental might take a hit.
Oh, yeah.
Yes, the mental might take a hit. Because what happens in pregnancy is when you have endo, your estrogen is really, really high, right? And then you see in pregnancy, yes, estrogen is high, but progesterone also rises, which your body is not used to that now. So you're a bit confused hormonally again. So, and then after you give birth, progesterone and estrogen drop. So these have a direct relationship with depression and anxiety in pregnancy. So get all the help you need. If you're an endo warrior and you're pregnant, don't feel ashamed for having even 2 nannies, even going to stay with your mom postpartum. Like, you need the help because you're more vulnerable. I don't know what your experience was.
Exactly that. With both my kids, but the second one was even worse. With both my kids, I remember I had such a difficult
Pregnancy?
No.
Postpartum.
Postpartum. I remember it was actually during COVID, so even worsened. Like one day I even put my kid in the car and just started driving. Usiku na kuna curfew. Just started driving all the way. I used to live somewhere here in Westlands. All the way to Mombasa Road. Naendesha tu, nikafika petrol station, I sat down, I started crying. I had such a horrible postpartum.
How about the pregnancy?
Pregnancy was good. The only thing, I used to be scared that something might happen, because I knew that it was a delicate situation coming from, endometriosis to now pregnancy. But my doctor was very supportive. So even 2 weeks before my baby, I was just like, every day I couldn't sleep. I used to think something is going to happen, the baby. But then the doctor said, if you're going to be behaving like this, let's just take you to theater. The baby is ready to come out anyway. Yeah, so I did. But the pregnancy in general, both my pregnancy were not really that bad. I guess only the mental. Yeah.
The mental. Now, for instance, someone who is not mentally strong, and things are happening during this pregnancy, they probably don't even know. Sometimes you're alone. You do not even have a partner. Sometimes you can't even afford support, to just go and see a therapist or someone. How do you go about balancing your psychological and emotions?
I think that's such a nice question, because I've just thought about like a 19-year-old girl who has postpartum depression, or depression in pregnancy. So I think, first of all, this is why this is so important to have these conversations. And I was telling you earlier, the kind of impact you're having. There's someone watching saying, oh my gosh, is this what I'm dealing with? And maybe tomorrow they'll pick up the phone, call the doctor. You probably have changed a life, saved a life. So let's keep having these conversations. But on a more serious level, if somebody is very severe, if the depression is bad, you're not leaving bed, you're thinking, you're not eating. Some women honestly even get suicidal. Yes. We do have a lot of medicine. And I'm a big advocate for, you don't have to tough out your pregnancy. If mentally you're struggling, please come. We can put you on the lowest dose of the safest antidepressant. Pregnancy doesn't have to be this thing that rips your mind apart.
Oh, yeah. And I think that's the narrative that has always been, we ni mwanamke, vumilia, wenzako wamevumilia.
Even with it's such a damaging mentality, honestly.
Yeah.
And people are scared of what will the medicine do to the baby, but we have so much research, so much research. I have patients who I have put antidepressants, and their babies are walking around happy, healthy. So we have this fear of the antidepressant will harm
Will
my
affect,
child.
yeah.
But do you know what? The depression is what will harm your child.
Yeah.
How does it?
A woman who is depressed, you can transmit that same depression to your child, such that later on in life they will be depressed. So it's actually better for you to take the medicine,
Be okay.
be okay, and then your baby, the most important thing for a baby is the mental health of the mother.
Yes.
If they are seeing, even internally, if you're crying, you know they're feeling.
Yes.
Yeah. And especially if you have another child around you and you're depressed, they know. They feel it.
They feel it.
So don't be scared. Run towards it, as in get the help you need.
Yeah.
Yeah, get the help you need.
I
No.
remember after my second, when I had my baby, I had really bad postpartum, and my baby just never wanted me to hold her.
Wow.
She stopped breastfeeding at 2 months.
Yeah, they can tell.
They can tell. And she used to cry. Oh my God, usiku yote. And so I'm depressed. And then the worst thing I did as a mom is not get a stay-in nanny. So my nanny used to come and live. So at night it was me, my depression, and that freshly broken up, me, my depression,
And
a
the heartbreak.
a crying baby, and then I start crying, and then my son starts crying. It was horrible.
It was
Please,
brutal.
if you're a mom, get a stay-in nanny. Have your sisters, your cousins, everybody come to live with you, because no, it was it almost drove me to the edge. I even got admitted
Thanks for sharing.
to the hospital. Like, it was really, really bad. So nowadays, when I see people having babies, I'm like, having kids, I tell them, have a stay nanny, and even if you can afford, have another person, or even have your relative come to stay with you, because it's not an easy journey.
Yeah.
Yeah.
Well, thanks for sharing that. Thank you so much.
So is that where, Doc, now childhood trauma comes from? In
Right.
connection to this reproductive health issues or the mental health issues per se?
Yeah, I think where it comes in is that there was some research that was done that showed women who have childhood trauma are more prone to having these issues later on in life. Because you might be wondering, how come you get endometriosis and this other person doesn't?
Does not.
So there are things called risk factors, right? So childhood trauma is one of the psychological risk factors. And you might be wondering, what is trauma? I feel like that's a word that's thrown around.
Yeah, because when she asked me trauma, I was like, no.
Yeah, but let me break it down, because
What's
maybe after I
trauma?
break
Yeah.
it down, you might be like,
Yeah.
maybe I have it. So of course there is the what we call the typical childhood trauma, like neglect, abuse, you know, those ones. Those ones, of course, they are clear.
Yes.
Yes.
Your parent
Black and
abandoned
white.
you. Yeah.
It's clear.
But there are also some things we call adverse childhood experiences, whereby it's one experience, but it really impacted you.
Okay.
So I'll give you an example that's very, very common, and people don't think about it much as trauma. You know, bullying.
Yes.
Bullying in school, that's trauma. Another one is whereby parents separate or divorce. So even if they don't divorce in a very catastrophic, dramatic way, that still impacts the psyche of the child. Another adverse childhood experience is, of course, death of a parent. So I think maybe when I'm phrasing it differently, you might start thinking, okay,
It makes sense.
maybe I've gone
Well.
through something.
So it could just be like just one experience.
Yeah, one adverse experience, as opposed to, you know, the other ones that we think about, for example, abuse, you know, sexual abuse, goes on for a long time.
Yeah.
Sometimes even just one incident, that one is still childhood trauma. So later on, it can, and the thing about trauma is there's a concept called epigenetics. Do you know that you can go through something that alters your DNA, such that conditions that were not even there in your family, now they start showing up. We saw this concept in Rwanda during the genocide, whereby because of the genocide, it affected families such that now they start developing conditions like bipolar, schizophrenia, you know,
Things that are usually like hereditary.
you try and, my grandmother never had, my great-grandfather never, but now it's in our family.
All of a sudden, one person has
Trauma. Trauma affects, and that's why you must heal physically and mentally for the sake of your children.
children.
Because in the same way that trauma can be passed down, healing can also be passed down. So there's hope.
Yeah.
That's encouraging.
That's very
Because we
encouraging.
talk about trauma being passed down, we never talk
Yeah.
about the healing.
The
being passed
healing
down.
process.
It can,
Yeah.
it can. So what you're doing right now is healing your own generation and even
Yes.
other women who are watching who will open up their minds to this.
Yeah.
Yeah.
Now, Corazon, at this point, you decided now to come in public
Yeah.
and tell us about the condition that you've been struggling with, and you healed, and you're able to have your kids.
Yes.
How was the feedback that you got from the public?
I think a lot of women are very encouraged, but I also think a lot of people, especially on my social media, they're not aware. So every time I talk about endometriosis, I get a lot of like messages flooding, people wanting to know how to get help, how did I know, because some people suspect or they see my story and they think, okay, maybe I might be going through the same thing. And yeah, so, and a lot of support. Like,
yeah.
I didn't realize how many women have gone through the experience that I've gone through. So, you know, when I talk about it, I get a lot of support. And I
When-
also get to support other women.
Yeah. So when you found out that you actually many, how did that make you feel?
I don't know. It's kind of encouraging, you know, just to know
Yeah.
that we are fighting. We are warriors against this thing, and we are fighting it together.
Yeah.
And we are also helping other people that don't know about it or you know are not aware that they have it to be aware.
How about feedback from men?
Wait, there's one feedback that bothers me a lot on my social media. Every time I post in a bikini, people see my scars. Usitubebe ujinga bwana. Umefanya lipo. And I'm just, but at some point I used to, but nowadays at least some of my followers just go back and tell them she's an endo warrior. Those are endo scars. But yeah. Then what else did you ask? Sorry.
No, I asked how was how the men.
Oh, the men.
Yeah.
The men just,
feedback.
they never, they support me. Like recently, I think today in the morning, I got a message from a guy who was saying the wife is going through it and if I can. So you find that even men, they kind of want to understand and they relate to our problems. Yeah, I've never gotten a man saying anything negative.
Yeah. So in the case that someone now says out loud about their condition, and probably they are in an environment that people just don't understand what's going on with them. They get bullied, they get, this backlash. How do they go about this, especially when it comes to their mental health?
Yeah, and we're talking about the journey to advocacy that you have stepped into.
Yeah.
It can be tough when you're out there putting your story out there. It can be exhausting. Please take breaks when you need to.
Yeah.
And if you're not ready to respond to a DM, you can even just say, I've seen your message, I'll respond when I
Yeah.
get a chance.
Yes.
Because advocacy is, it's tiring mentally, it's
Yeah.
draining, it's draining. So take the breaks, but also feed yourself. So I think as an advocate, if you're going down this journey, partner with, I like that you talk to your gyna a lot, partner with experts. If people are offloading on you mentally, tell them, okay, go to this therapist,
They'll
go to
help,
Chiromo. Yeah, because sometimes people want you to, they want to vent.
Yeah, but there's not much I can do other than just
Yeah.
tell you share my story and encourage you and send you to someone.
Exactly.
Yeah.
But sometimes you find someone comes, they don't have money and they're really suffering. That breaks my heart sometimes. I just don't know what to do. Like it really breaks my heart.
I can advise you to, I know our public healthcare system has flaws for sure, but that's the place you can always send some of those people, the Kenyattas of this world, or especially for endo,
Yeah.
they'll always figure something out. Maybe the waiting time would be long to see the gyna,
But they'll get there.
yeah, 'cause, we must at least give them something, and the public system works.
Yeah.
Thank you.
All right. So as we wind up, Corazon, probably to someone who looks up to you as an endo warrior, do you have something for them to say something to them?
I will just say that you're not alone. And if it's making you, not have babies or something, you can get help. The surgery can be expensive, but it's not invasive. And I'm always here for you. So come to my DMs if you want to talk, if you want some advice, and I'll share my story, and we are together in this. We are warriors, and we're gonna overcome. A lot of women go through this. I heard it's 1 out of 10. So in a room, if you're 20 women, just know there's someone else that is going through the same pain, and you'll get better.
Yeah. All right, Doc, in regards to, Mindfest edition 2024, please say something to people who are probably just going through this childhood trauma and their reproductive health issues.
Right. So for me, I'll say that, as I said at the beginning, your hormones and your mind are connected. So as a woman, it's very important to be informed. It's very important not to gaslight yourself. You're not being dramatic. Even if your periods turn you into Shrek, it's okay. But lastly, just get the help that you need. That's why we're here. That's why Chiromo does this. We've got so many professionals, from psychiatrists like me to psychologists. And even if, for example, you're watching this and you're in a bad, dark place, you can even come for an admission. So get the help you need.
Can we get the services online for someone who's probably not in Nairobi?
So usually what we do, yes, let's say if you're not in Nairobi or out of the country, we usually advocate for Zoom. However, if you're here, make a point to see your doctor face to face. There's a very big difference when you see your doctor face to face as opposed to online.
Yeah. All
Can
right.
Can I just ask one? How about the men? Like, what advice can you give the men in?
Brilliant question. I want to also validate the men who are partners of women who go through hormonal changes. I want to validate that it's okay for you to have feelings in response to what you're seeing. So if your partner is going through stuff and it makes you feel scared, anxious, worried, I want to validate you that that's okay. But what's not okay is how you react. For example, if you react in a negative way and telling them, oh, unakuanga tu na drama, or you say, oh, you see now you're going to be infertile, I might as well find somebody else. So your response really matters. Your response, let it come from a point of information. Get informed, get informed, get informed. Because as you've seen with her story, it might start with infertility. A few years down the line, it's 2 kids,
True.
So just get informed before you respond.
Yeah. All right. Thank you so much, ladies, for sharing, Corazon, your experience, and Doc, just sharing with us insightful knowledge about this issue. All right, guys, that was it. Us getting to understand the relationship between trauma, reproductive health issues, and just getting to understand what is it that we can do. That's it from this session right here at the Mindfest 2024. Thank you very much for watching. I was joined by Corazon Kwamboka and Dr. Vundi, and my name is Miss Kithinji. Thank you very much. Hi everyone, welcome to Mind Fest 2024, and this is the live podcast session. My good name is Miss Kithinji, and on set today I am joined by beautiful ladies who I'm going to be given the chance to introduce themselves before we introduce the topic for today. Welcome, ladies.
Hi, thank you so much for having us.
Please
Yeah.
introduce yourself.
My name is Waidera Karen, a communication practitioner.
Uh-huh.
My name is Zawadi Kimari. I'm a psychologist with Trauma Hospital Group.
And I'm Melissa Makungu. I'm a content creator. What's Cooking KE on Instagram.
All right, welcome, ladies. Now, our topic of discussion on this session is we want to debunk the myths that are associated with ADHD, OCD. We have the likes of dyslexia. That's how we pronounce it, Doc?
Yeah,
Yeah.
dyslexia. Dyslexia.
Dyslexia. Okay, there's that, and then there's autism. And I believe some of the people that are probably watching us have had such an experience, or you've interacted with someone who has such an issue. So we're going to be understanding it more, and also just getting to understand about the experiences that some of us might have had, so that we can have Doc try to make us understand more. Yeah? So maybe let's start from having to understand what ADHD means, because I've had it. People use it very often. But do we really know the meaning of that? Tell us, Doc.
So ADHD stands for Attention Deficit Hyperactivity Disorder.
In layman's language, what does that mean?
Just hold on, hold your
Okay.
horses, hold your
Okay.
horses, and give
Okay.
them a pole so they don't run away from you.
All right.
So ADHD is a neurodevelopmental condition. So what that basically means is that it affects the way your brain processes information, and it's a condition that someone is predominantly born with, and then you grow with it. Although there are recent studies that find that you can be born without ADHD, and then different circumstances in your environment then would alter the way your brain continues to develop itself, and then you develop ADHD. But commonly it's diagnosed in children from as young as 2-3 years, but actual diagnoses are made at the age of 12 thereabouts. That doesn't mean that if your child has ADHD traits at age 8 or at age 9, they won't get treatment. They will still get treatment. So scratch that whole attention deficit hyperactivity disorder, very long word. ADHD basically is a condition of consistency or inconsistency for that matter. So it affects your brain's capacity and capability to do these fine-tune activities, like plan something, start it, see it through to the end without procrastinating, without missing a beat, those kinds of things. The ability to sit and listen to this very, very long soliloquy that I'm saying here without starting to think about, oh gosh, I left something in the microwave, or oh my God, what's that song playing? You'd lose your attention, you'd forget things, you could easily forget, just the name that was said right before you, I wouldn't be able to remember now, your name, for example. Not because this person is being weird, but just because their brain is trying to process too many stimuli at the same time. So that's what's happening inside that we don't see. What we see is forgetfulness. What we see is poor organization. Yes, carelessness. What we see is laziness. What we see is someone who seems very careless, for lack of better word. Yes, and emotionally dysregulated. But then what's going on internally is everything that is going on around this person, their brain is paying a lot of attention to all of these things at the same time, and not able to zero in on one thing. Makes sense?
Yeah, it
Yeah.
does. It
Yeah.
does. So I've grown up knowing OCD, someone who has OCD, someone who likes perfection, nini, such kind of things. Is that what OCD is?
Well, yes and no.
Okay.
Yes and no in the sense that not all OCD is perfection or cleanliness. You can actually have OCD and not be clean. Just so
Okay.
you know, because there's a type of OCD that is hoarding. And when you're hoarding, then you have so many things in a place and they don't necessarily are organized. You see?
Maybe what is OCD?
That's where I was going to. So OCD is obsessive compulsive disorder. It is a brain condition that makes you get into this loop where your brain has obsessions. So obsessions would be thoughts that you can't really control them, and they come at you at any time of the day. And these thoughts then make you act so that you can reduce levels of anxiety or discomfort for yourself. So like you can have, let me give you a case in point. Not all obsessions are visible where that, like you see the person doing the thing. So like maybe someone who has a check-in type of OCD, they'd consistently be checking things. You can have covert symptoms where your symptoms are internal. So you think, oh my God, if I don't say after at the end of every sentence, something really bad is going to happen to my loved one. So therefore, I am going to say that. So at every point you say that. Or you think in your mind that if I don't do this, if I don't walk, for example, in a straight line, then someone that I love is going to get into difficulty, and therefore now you walk in a straight line. But then now sometimes it is, if I do not pray consistently, then something bad is going to happen to someone that I love. So every other time in your mind you're thinking, oh Jesus, thank you, bless my people wherever they are. And it's very uncomfortable because you can't help it. And if you don't do it, then you feel very uncomfortable.
Oh, okay. Now, how about this one, dyslexia?
Okay. So dyslexia is
Oh,
a learning.
dyslexia.
Yeah,
Okay.
it's a-
D is
it's a
not
learning-
silent, guys. Dyslexia.
Dyslexia is a learning disability. So what happens with dyslexia is that commonly also diagnosed amongst children, although we have adults who have dyslexia. Like Tom Cruise has said that he has dyslexia, and we can see that he reads. So that's also to debunk one of the myths that if you have dyslexia, then you can't read. The thing that happens with dyslexia is your brain's ability to recognize words, to decode. They're called phonology. Our English teachers will remind us that word, but the ability to recognize sound, interpret them, and then say it is what is affected. So this person will struggle with reading a lot of the time, and sometimes writing, especially difficulties in spelling. Not writing in the, like the actual sense of writing, because that's something else altogether. It's called dysgraphia. But then writing in the sense of their spelling may have issues. Their reading will have a bit of issues. And then in school, you'll say, oh, this child, they're just dumb, they can't read. No. They actually can. It's just that they're having difficulties processing these sounds and these words.
Yeah. All right, let's put Doc to a rest for now. We're going to come to understand what autism is, because I understand it's a whole spectrum. But let's hear from Melissa. What among these conditions that have been mentioned that you resonate most with?
ADHD.
Uh-huh.
I'll tell you this for a fact, even as she was talking.
You're struggling. You say,
I was struggling. I'm like, what do I do? Do I do this? Do I do this? Because focusing is hard. I feel like, first of all, yes, I understand you have to tell us all those things, but it's like, for an ADHD person, like for me, make sure you summarize within the first 10 seconds.
Oh,
After
you
that,
lose
you've lost me.
attention.
Yeah, after that, you've lost me. I'm not there anymore.
Yes.
I'm there, I'm listening, but partly, now I'm looking at everything else. Yeah.
Okay. So at what point did you actually realize that you have ADHD?
I didn't realize. Doctors did.
Okay, at what point?
I was in high school. Yeah, so I was in high school and I was very notorious. I never stayed in a school for more than a year. So every other time I was just being expelled from this school. Very bright student, by the way, top of my class, but at the same time, most notorious. So it's I'm just chasing something. It's like, okay, I'm good at this. I'm good at studies. So what else is there to excite me?
Yeah.
So at some point, my mom was like, okay, no, we need to check what's wrong. And that was after I tried to say that I have an addiction, just to save someone's, can I say ass?
Yeah. Rear back.
Just someone's rear back.
Just to cover up for someone, I decided I'm going to say that the drugs that were found with me, which are cigarettes,
Were yours?
were mine.
What?
So, and I stuck to it. I stuck to it to the end. I told the principal, I told my mom. My mom was like, I've never seen you smoking. I'm like, no, I do. So they checked me into Chiromo, actually.
Oh.
Yeah. Because now that was part of the principal's terms, like she has to go to rehab, then she can come back. So I went, and then they quickly, of course, read my bullshit. I was just there, I'm like, so what are the symptoms you're experiencing now that you've not been smoking? I'm like, I'm shaking.
Come on.
I'm lying, you know, you're just trying to, So now they got to the bottom of it. They're like, okay, we know now what's wrong. Like now, go see a therapist, and then it came out to be ADHD.
Yeah.
Yeah.
Waithera, what is it that you can resonate with among this?
ADHD, definitely.
Uh-huh.
You know the number of times I wanted to interrupt all of you? I was like, okay, yeah.
That's me. That's me
You
too.
know, I was like,
Yeah.
and I'm like, okay, okay, why there? We are learning. Yeah, so mine is definitely ADHD.
And at what point did you realize you have it?
Mine was COVID, 20, it has to be
2020,
no,
21?
2021.
Uh-huh.
Definitely 2022.
Okay.
Yeah, it was
Just the other day.
Yeah, so for me, COVID for me was really a depressing time, in the essence that I worked in a very, very good agency, and I worked in an agency that really nurtured me. One thing I keep saying about where I worked, my former CFO, is that I don't know if she had discernment or she just knew these things, because she really extended me grace. Yeah, when I joined, I remember I joined media buying, and then I was like, I'm so bored of this media buying. Sometimes I don't know if it's, okay, personally it's favor from God, but also I've been put in positions where people just have a lot of grace towards me. So when I joined the agency, it was called Red House Group, and I'll just, of course, I just want to commend Esther Ngomeli, who was my CFO. And when I joined it, I started with media buying. Media buying was boring, because media buying is basically your billboards,
selling
your
airtime.
billboards, your whatever. I was like, what is this? My boss then told me, not my CFO, my boss told me, come and sit somewhere here. When I went to that place, then I saw guys from PR. Guys from PR were having so much fun. So much fun. There was so much excitement. I was like, Jesus, this is what I want. Because, I remember ADHD, you're rushing for dopamine. You're rushing for excitement. You want the next. It's like we live in a danger zone. Yeah. So media buying is just, I was so bored. So I decided, PR, okay. But I'm like, how do I move? So I remember I went and talked to, he's now my mentor, I went and talked to Githinji. Slowly, I was like, Githinji, can I please join? Then Githinji is like, okay, sawa, I'm going to give something. So I used to hide. I used to be in media buying, hiding, going for PR meetings, pretending I'm in the washroom. Imagine. Then I remembered one day I told myself, and I'm also very bold. So I told myself, what am I hiding? I went and told my boss, Rose, I really want to move to PR. And she was like, okay. I'm actually Karen, I know you're a brilliant girl, so you go. That's how I joined PR. But now by the time I was joining PR, COVID came. So now, remember COVID, nobody knew what was happening. Nobody knew.
We are just at home.
We're just at home.
Stay home,
So,
lockdown.
nobody has time to teach you, mentor you, because we don't know. That was when literally all of us did not know what was next. So now I've joined this new side. I've done it because I know I joined in 2019 December. I've done 2019 December, January, Feb, my grandmother dies, Feb again, lockdown. Now we're told work from home.
Yeah.
nobody has time to mentor somebody new because everybody's trying to secure their jobs. Remember, everybody's trying to secure their jobs. Thank God the agency did not want to fire anybody, so everybody learned. So for me, COVID area was a bit depressing, and that's how this one time I just went and admitted myself at Nairobi Hospital. But before that is, I saw, what did I see? I saw online. I actually like digital things because I used to see this thing called ADHD, but I did not know about ADHD until then. I used to read, but then I used to read those things and I'm like, I feel like I'm like that. So when I was admitted, I remember I went and I saw my doctor. Now the doctor at Nairobi Hospital, because he's telling me, are you depressed? I'm like, yeah, I feel like I'm depressed because but it's like, okay, it's COVID, that's why you're depressed. Then I told him, do you know what? There's this thing I've been reading about that's called ADHD. I think I have it. It's like, really? Then he just told me, okay, let's just do some analysis. Let's do some you see a psychiatrist, a psychologist, let's go and figure it out. So he gave me some questionnaires, there were some tests. Then he was like, yeah, you actually have ADHD. Now when I started reading, I was like, oh my God. And for me, funny enough, I think I was an ADHD with an OCD mother. Now the cleaning type. So me, I did not grow up in a conducive home because OCD and ADHD are like the enemies, you know? You're the complete opposite. So you both trigger each other. You both trigger each other. Because my mom, even like this, oh my God. Those things scare. Like, she'll not concentrate. She'll be like, oh my God, this thing is not, it's not lining. Me now, I forget. I forget what I'm saying. Mara, I'm careless. In school, even I used to get in trouble, but I also think, I think I'm scared. I used to be so scared of my mom, so I never used to do anything extreme. In fact, I keep telling my mom, do you know the only reason my mom used to be called to school every week? But the only big thing I ever did, making noise. Me, I used to be a noisemaker. I used to disturb. So, again, another one of ADHD is just disturbance, interrupt. I used to be a noisemaker. Meanwhile, I was times 100, times 1,000, times... Me, my mom used to be called to school every single week because of how much noise I make. But eventually what happened, but I never got kicked out because of anything extreme. I used to be also very scared. So I'm very guarded as well. But our house was not a good house in the terms because it was just me and her, and we have different now personalities. But now when I learned that I have ADHD, for me it was now, it was a mixed emotion because it's like, wow, now you know why you're the way you are. But then it's like, damn, so there's no hopes for me. Because you're told you start something, you don't finish. People with ADHD, you have very many ideas, but you can't execute. So I think for me it was like, wow. Now I know I'm not crazy. So kumbe, this is whatever I have has been thoroughly defined. But then again, now it's like, wait. So I used to think I can be the next president. Okay, maybe not president, but since I was like 7, I wanted to be like the next communication person at State House, the spokesperson. But now I got bored of that even that one, I got to State House a few times. I've done jobs at State House and I got bored. So I don't know. So I'm like, are you telling me I'm going to keep chasing? Yeah. So basically ADHD.
Yeah. Now, Dr. Zawadi, is there any relationship that connects OCD, ADHD, autism? Is there any relation?
Yes. In fact, that's what I wanted to say, that you'd be very, very surprised potentially if maybe your mother has some form of ADHD. Because ADHD and OCD are very, very comorbid. In fact, so comorbid that I think it should be around 37% of people who have OCD also have some form of ADHD. And for them, it's a very confusing situation because you have this very unique set of traits and symptoms. I don't like to call them symptoms. I like to call them traits because symptoms is, like...
Sounds like a very bad
boxing. You're boxing someone, like, the way you'd think that, no, I'll never be this. No. It's just traits. We work on them. We figure it out. We see how to live with some of them. So sometimes people who have OCD equally have ADHD, and sometimes it can work in their favor. In other times, it actually agitates those traits. For example, if you have OCD, and then you have higher levels of anxiety, when you take medication for ADHD, it will increase your anxiety levels, so it will make your OCD symptoms a bit more difficult to regulate and manage. But then there are other times where they work very, very well symbiotically. Even, like we were having a conversation before about, couples who one has OCD and another has ADHD. Sometimes it works very symbiotically together because some of the difficulties that one has in ADHD are sorted out by OCD traits. And then some of the symptoms that someone may have from ADHD, from OCD can be sorted out from the OCD side of things. So, however, because OCD is a very physical thing, it's very, very physical because of discomfort that you feel. Anxiety disorders have a lot of physiology into it. Like when you're feeling anxious, you're feeling nervous, your body is uncomfortable, you can't. So a lot of the time it is the OCD symptoms that then tend to seem like they're overriding the system. Makes sense? Because if you leave things like this, your ADHD mind will say, you can just leave it. But then the OCD mind will say, no.
But I think my OCD is definitely my work. I know one thing I do is I hyper-fixate. I know I'm an overachiever. That's one thing about me. So when I see people, when people do work that is not, when they don't plan, they don't plan their work. It is not organized. Oh my God, I have a structure. I like structure and I don't like, but you like structure and you don't like structure. Because for me, work, now my house, I can just sit, I can chill. But for me, work, it has to have structure. I actually really struggled in my previous job because it did not have structure, and I couldn't. And and they still did not give me dopamine, because I don't know. So that's the thing I realized, because I can do one job that excites me, and I will, oh my God, I will over deliver. Case in point, Mindfest, the over deliver. But you give me something. I think I was told to send a quote. And that quote, it was some job that I just did not, I knew this job is not going to work out. I'm not going to feel it. And I knew my heart was not in it. It has taken me a whole month. Karen, umetuma. Karen, sawa, nafanya. And it's literally, it's just 3 items. But I couldn't. This Mindfest, I could not sleep. I haven't slept. Literally, I hadn't slept for 2 months straight. My mind was on overload. Oh my God, we probably need this, does this logo have? We probably need to think about this person. We probably need whatever. But a simple quote, I couldn't do it. So I think I understand that, like the OCD and whatever. I think it comes in its own some weird form or way.
I think before we come back to your question, I'm sorry I have to do this for
It's
you.
okay.
Maybe you can tell us about your fixations, because in ADHD we don't call them now OCD traits per se. It is more hyper-focus and over-excitability about particular things. I don't know whether you experienced that as well.
Yeah,
Yeah?
but I would say, just like Karen, actually, it's work. It's literally, it's just the same thing. When you were talking, I was like, okay, so it's just all of us now. Because at work, my former workplace, I quit because I got bored. It didn't have structure, and then once I can get to a space that is chaotic, but once I plan my things like this, I don't want anyone to come and move this. Don't
Chaotic but exciting. You
Yeah.
want chaotic but exciting.
Yeah. So once I come, let's say I come into work and I know I'm going to do A, B, C, D. Don't put something else hapo katikati. Once you put like something there, I'm like, okay, now I have to sit back again and be like,
And reorganize.
yeah. So that point where I'm doing, you might think that I don't want to do it, but it's just I knew how I'm coming to work today, and I knew this is what I'm going to do today. So now you've just messed up my whole day by giving me something impromptu. And then people always tell me, Mel, you don't like impromptu, but you're impromptu. I'm like, yeah. Yeah, don't give me impromptu, but I am impromptu. I'm the sort of person who will call you, hi, and I want something done, because that is when my mind is
It's
there.
operating,
That's where
it's
I've
working.
reached at the point of my day. Yeah, so more or less the same. Yeah.
I think what I want to discuss about ADHD for me is, I want Doc, maybe you can advise me, the emotional dysregulation, because Me, that one is what I think I suffer from. So I do sometimes wonder, is it trauma? Is it ADHD? Is it, because people be like, this girl is bipolar. I'm like, wait, do you know what bipolar means? But you know, I like structure. So if you don't do something you don't do things the way I envision, and I have to tell you more than once, I'm gonna get angry. Then people are gonna be like, this girl is just chaotic. This girl does not know. And I'm gonna cry. Like, do you know how many times I've cried this month? There's so many times I sit down and I just cry. I cry. Then sometimes I watch, like, I was telling Ms. Kidinji that I love Nastoto, oh my God. So there's sometimes, and then there's another one called Disco Matanga. So my friend was telling me, Aki Karo napenda kucheka. I'm like, yeah, then there's sometimes also I just want to get into a space for like 20 minutes. I laugh. But then I can also just randomly cry. And then I can be very angry. But those are the things I really want to understand. Like even my ADHD, is it from also my trauma? Because my mom also was very angry when I was young. She was so angry all the time. So I don't know, did I take it, is my ADHD a form of trauma? Or was it there, but then just like things just, it was just unfortunately one after the other. Because now my mom has, of course I had a young mother, but now she's grown into this demure, Camelo. Like my mom, mamangu siku hata hizi hata kupigia hata inzi makelele, but where?
Back then.
Me and my mom, we were not even in the same, we never used to speak even for more than, we used to speak 2 days, not speak for 4 months. Okay.
Now,
So
Doc,
I don't know.
before you answer her.
Wait, you know, I still have your question.
Yes, you do. And
Do
Karen
not
has asked,
overload
has
my
asked
working
like 3
memory.
questions.
We didn't take
Okay,
concerta today.
tutafika hapo. Tutafika mali.
We didn't take medication. Melissa, did you take medication? Me, I didn't take, sorry.
We're gonna get to
Do
her.
I even?
Yeah.
Do I?
We're gonna get to her answers, okay? But first answer me my question, then
Yes,
we continue.
so wait. All of your questions
Yes.
are very much interrelated.
Okay.
But then now if you overload my working memory,
Usijali, I will come to her questions.
tutazidi kuzidi.
I will come to her questions, don't worry.
So your question was, no, I have forgotten. Wow. Your question was,
Hold on, you explained that they're related. You
Yes.
did answer that.
Yes.
Yes. I think
Yeah.
you answered that.
yeah. Oh, I answered part of your question. I remember now. So part of your question was OCD and ADHD, are they related? And the answer is yes. ADHD is comorbid with quite a number of other conditions. It's comorbid with learning disabilities. I do not like that word, but I will use it because that's the word that you'll find if you're looking on Google, inclusive of dyslexia. It's comorbid with OCD. It's comorbid with autism. It's equally comorbid with tics, Tourette's, and a bunch of other things. Now, you see, the thing about the brain is one organ with multiple functions, and sometimes the things that one condition impacts can equally open channels for another condition to equally impact on. Okay, so then it creates a lot of, a very weird interplay or interlinkage of different manifestations of traits. So yes, it is true. They are all linked, kind of. You can have someone with traits of, say, dyslexia, but then even with dyslexia, sometimes people who have ADHD can be told that they have learning disabilities. I don't know whether any of you experienced that in school.
No, I was too bright.
Oh, okay, good. You guys are on the good side
Also
of
on
life.
the good side of education.
Yeah, the good side of life. But then you see, that also comes with its own difficulties, because if you're too bright, what happens is, like what I'm doing right now, the teacher will explain the concept and then repeat, rehash, repeat, retake, over-explain. And now we go to example after example. Your mind has already caught the concept, it's moved.
We've moved on.
Yes.
Yeah.
So now, because the mind caught the concept and moved, if another thing is said in between, the mind did not catch that. So it's an in-between kind of thing. You can either have it in the sense that you process the concept and then now these people are, they're taking too long. So you move on to the next and then now they say something else and then you didn't catch that. So your information is a bit incomplete. However, there are also people who have ADHD who scramble words when they're reading. Even when you're writing on text or on email, you realize, Connie, this word, but I thought it's not here. How is it? What happened? It's because of the processing ability of the brain. Okay. And in the same vein, like what she was talking about, so answering her question, though I know you say that I shouldn't, but it's all related. It's all one question.
Kidogo tu. Let me talk to Melissa.
Yeah.
Melissa, what are some of the names that you were branded now when in high school? What names did they call you before now you realized that you had ADHD?
Just noisy. Yeah.
Noisy.
Mostly I was just noisy, or I don't know, just noisy. Attention seeker sometimes. Yeah.
Cloud chaser.
Yeah, cloud chaser. Okay, then while saying it was just attention seeker,
Yeah.
you would hear that. But to everyone else, I was just this bubbly, energetic person who fits anywhere. Because me, I'm chasing a high.
Yeah.
I don't care whether you guys are doing the wrong thing, the right thing. I'm
It's the
chasing what I
dopamine
want
for
to
you.
chase. Yeah.
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 All right, so Doc, tell us, what is the origin of especially ADHD? Is it trauma? What's the origin?
So I'll answer it in two ways. When in a family, well, ADHD has a lot of genetic relations, like genetic predisposition. So it is very likely that a parent or someone who has ADHD may pass on ADHD traits to their child. Okay. And then, depending on the severity of ADHD, then they may present symptoms or they may not present symptoms. Again, it's a yo-yo, like the way she was saying that in one of her jobs, she was doing exceedingly well, and then there's another job where she does not that great. So in an environment that works for you, you will thrive, and your symptoms may not be as present. But then in environments where they're not really cut out that well for you, then your symptoms act up a lot. So you can have even a situation where possibly I have ADHD, but then because my environment is allowing for me, then I can, operate like atypical, But then in circumstances where that is not afforded to me, where these accommodations are not there, then I crumble. Now you see, on the other hand, trauma can cause ADHD. Recent research has found that trauma can cause ADHD. And this would be very intense trauma that happens to a child when the brain is still developing. And then now it changes the structures of the brain and the neurotransmitters in the brain. And that then can result in symptoms of ADHD moving forward. So you can have someone who was born very typical, but then later on they start to present with symptoms or traits of ADHD.
Yeah. So are these traits something we can say they have solutions, or are they controlled, or do we have to live with people with ADHD in the society just like they are?
Okay, so I don't know whether the answer is solutions, but then I know ADHD symptoms can be managed.
Okay.
They can be managed through many, many ways. Sometimes medication is indicated depending on what's going on with the person. Sometimes medication is not, just behavioral intervention, coaching, finding what works for you, that works as well. And then now, for society, having a better understanding of the person is good, because then you can create, environments and allowances for this person in a way that works for them and in a way that works for you.
Yeah. Now, Waithera, hearing what Doc has said with this condition that you just realized in 2022, how does that make you feel?
I think I'm a very self-aware person. Yeah. One thing I am is self-aware, but self-aware is only 70%. Self-aware is usually just 70%. You have to put in the rest 30% into the work. So me being very self-aware is now I actively try and do things better. I also don't like saying I have ADHD, because for me, yes, I do have it, but I also don't want to make it my whole personality. Yeah, you see, because there's also a thin line between having something and also just making it your whole personality. So I try not to make it my personality, but I know I know I get to deadlines. I will get to my deadlines. So I already know that it's fine. So if I want to take a whole week, but I know I have to submit this on Friday, me by there I'll just be fine. Well, what do I do? By there I just take it. Yeah, I just take it by there. But at least I know by Friday I have to deliver, and I know it's something that I actively work on. What I know is social cues. So for me, that is what now disturbs me. I come off a bit, bitchy, rudy, and also too much. But I also discovered if I'm too much for you, then you're not enough for me.
For sure.
For me.
Yes.
Yeah. So because at the end of the day, I also still have people who love and support me. So I now started focusing, reshaping my thoughts. So this person finds me too much. Let's go to the next. Let's go to the person that finds me enough for them. Yeah. This person finds me, this person has decided to judge me and whatever, so let it stay there. So I actively work on these things, especially social cues. I know I'm very blunt, so I'll be like, I apologize a lot, so I try, I'll be like, okay, so, because sometimes I say something I from the bottom of my heart.
It was so
genuine, innocent, but where maybe really relationships that people just out there and their perception, because I can be like, Sasa, so somebody can tell you something and be like, ati sasa tukemaji hapo kwa comment on the so I'll be like sasa unakayekwe and somebody else will be so offended. So the number of times, and that one has also caused now social anxiety because now I fear going to people. But I think for me it's just is that I'm self-aware, and now I actively, the things that I can work on, I actively work on them, and now I choose to see the positive side, because the positive side for me is I am, I'm a guru. I do things with my whole heart, and I'm passionate. So I focus on that, and not now the negative sides. Of course, I cry, but I also smile. I go and watch something and I smile. So I think I take it in nicely these days.
All right, Melissa. As we wind up, for someone who is probably in the same situation you were when you were younger, they are probably being bullied because people don't understand them. Please say something to them.
Well, as someone who's still there, because unfortunately for me, I love that she said that she's now self-aware and how she knows how to separate people. For me, I think she'd be the best one to advise them, because I'm still in that zone where I'm still people-pleasing. I'm like, if someone goes ahead and says, Melissa, this happened to you, or you're being too much, I'll tune down for them, but I won't be myself. Like, or if we live here and you say, like, just make a call, stop talking to me. Actually, there's also this part where I cling on to people so much. Or we live here, we were talking, we reach outside the door and you don't talk to me. I'll start asking myself, did I do something wrong? Could you go over the podcast? What did I say? What did I overthink, and then I go.
That's also an anxious attachment.
Yeah.
I learned about attachments the other day.
Yeah.
You're an anxious.
I'm like,
oh my God, my relationships would have been so much better. You're an anxious attachment.
Now
actually go read those.
Do
a quiz.
I'm an avoidant.
You're an avoidant.
I can
Yes, I am an avoidant.
If you give me a long text, I'll go through this.
Do a quiz, but anyway, I've diagnosed you. You're an anxious attachment.
All right, let's have Doc answer that. Talk to Melissa, Doc. What can she do just to make it better? And also just speak to someone who is going through this, and where can they find support as we wind up, please?
Okay, so, hey, you guys are, my mind is overworking. I'll start first of all with something that both of them mentioned, but I think she mentioned more than Melissa did, about emotional regulation. You see, one of the things that would make you a people pleaser is what we call rejection sensitivity dysphoria, and it's part of emotional dysregulation that comes with ADHD. And you see, now the thing about emotional dysregulation in ADHD, it then becomes one of the biggest hallmark symptoms of ADHD, leave alone the forgetfulness and disorganization and whatnot. The emotions is a very big part of it. So if I may say something, the first thing is to learn how to be very, very self-aware, and then to notice areas that trigger this RSD for you, because sometimes it's very specific that I had a good time speaking to XYZ, and therefore I would like to continue that conversation. She looks like she's someone that I'd really enjoy having, spending time with. And then now they're not talking to me anymore. So you see that now, that emotion, that emotion makes you feel some type of way. So if you're able to find the actual triggering points, it becomes easier to know how to navigate it, because now you know what you're fighting. You're fighting that you wanted this thing from this person, or this person made you feel very excited, so it is that excitability that they gave you that you're trying to carry on with. Makes sense?
Support.
So for support, if you feel or you think or you're struggling with any of these conditions, feel free to reach out for help. Seek out for psychologists, seek out for psychiatrists. You can always call up Chiromo Hospital, and they'll be able to run you through the entire process that was described here, where you meet a psychiatrist and a psychologist, and you're taken through assessments, and then you're evaluated, and your treatment is individualized to meet what is going on with you.
And I think, can I tell just before we close, can I tell Melissa something?
Yeah.
It also, I'm literally the same, but I'm turning 30 in December. So thank you.
Congratulations.
So this year, I was very intentional about my healing.
Yeah.
But it doesn't take a day. It doesn't take a day, it doesn't take a year, it doesn't take whatever. But I became very intentional. I told myself the woman who goes into her 30s now is self-aware. And I was actually telling you before, the thing about also, especially when you have something like this, people pleasing, is that when you start now intentionally healing, it's going to be lonely AF. It's going to be very lonely. You will cry daily. It is going to feel like you're in the worst pain of your life. But if you're intentional, you're going to move. I don't have friends, and like a lot of, I cut myself out. And I've been intentional about a lot of things, because I really want the lady in her 30. I already see the woman in her 30. I don't want to be the one that reacts, the one that is forcing people to love me that don't love me, the one that is following relationships, the one that is crying, the one that somebody just says Karen is a bitch, and then I know I'm not, but it affects me the whole day. I told myself, I prayed. I also prayed. I'm a very spiritual person. I told God I'm not going to 30 like that, and that's why I decided to be healing, to just start my healing journey. But I'm saying it is painful, lonely, crazy, but it is worth it. You start learning yourself. You start talking in a very different demeanor. But it has to be from you, and you just have to make that decision. I also think I don't feel like I need medication at anymore, because you see now I'm self-aware. But it takes time, and of course the days like addiction, there are days you'll sleep. But if you're really intentional, you'll see changes
For sure.
And then something else on that is that, you see, when you have ADHD, because of constantly being misunderstood, you just miss everything, misrepresented, then it comes with a lot of trauma involved as well, because you can imagine when you're a kid and then people are just misunderstanding you. You can't read a social cue vizuri, so now people don't want to talk to you, don't understand why. It can form a lot of also a misrepresentation or a misconcept of yourself that is not accurate. So also shedding that is equally very, very painful. It's a very painful process. But then now from there, then you forge on a new, now you come to yourself. It's like a phoenix. I call it the phoenix effect when I'm talking to my clients.
It's actually, you get to know yourself. Me, the one thing that changed me is when my ex-boyfriend told me, Karen, you don't know. He told me, Karen, you don't know who you are, because that's how it's easy to manipulate you. He told me the day you know who you are, the world will not be ready. And that's why now I decided to, that's why I quit my job. I decided to come up with this under just the organization of the Mindfest and everything. And everything after that for me has just been clear. Because I told myself, this man was constantly putting me because I do not know myself. You have to own.
But most people with ADHD don't know themselves.
And by the way, it's not your fault. It's actually something with the executive function. So ADHD affects executive function, and in the executive function is self-awareness and self-recognition. And that's something else.
Pick people's characteristics. Like if I'm hanging out with you, I'm going to act like you.
Yeah.
I hang out with you, I'm acting like you.
Yeah.
You like
Yeah,
that.
yeah.
As I move on, it
Chameleon.
depends on who
You're
is there.
chameleon,
Like I'll
yeah.
just
But then you just have to figure out
That's why
who
people
you are.
usually say like you fit in everywhere. No, it's
but you
not-
don't, you're just
yeah, you're just
mirroring.
you're just mirroring them.
Yeah.
If I go to this group and this is what they are doing, that's what I'll do. If I go here, then Melissa, you're changing. I'm like, no, I'm just me, but I just don't know
I'm
where I
like,
belong.
yeah. And the people pleasing.
Yeah.
Guys,
Okay,
I
well,
have
Paul, we have
a
we have
confession to
completely
make.
taken over your
No, it's
conversation.
okay. I actually have a confession to make because I feel like you guys were speaking to me.
Yeah.
And I'm just here finding out like, might I be having ADHD? I have been the most misunderstood person ever. I have been called a snob. When I came to realize I'm just socially awkward. I have been told I am unapproachable, especially when I got into college and someone just came to me, you are
Yes, that's
unapproachable. I'm like, me?
But
I
they
am
believe you.
unapproachable. I was so surprised. And then when I came to the limelight, now people started saying I am a snob. I'm like, no guys, I am socially awkward.
awkward.
I don't even know how to talk to you guys. But yeah, it's been but thing is, I am self-aware.
Yes.
Yeah.
Over time, I came to realize it's either you fit where I am because I know myself. I know I am not a snob. You guys will have to take me the way I am. I people pleased for a while, but then I came to a point where like, guys, we have to fit in. We have to
Yours
coexist.
is not ADHD. It's just this. All of us, and then now, okay, leave not the ADHD symptoms. It's just you don't know who yourself. But when you
Yes.
know yourself and you own it, then all these things will not be
Yeah.
bothering you. So it's not ADHD for you.
And the
it's
structure
that,
too.
It's that you owned now
No,
who
but
you are.
you know, I was really I saw a meme today on Instagram and I related to it because they say once you have something, ADHD or anything,
Yeah.
and at the same time you're self-aware, it's still a struggle.
Yes.
Because I know what I'm doing, but I'm still
Yeah.
doing it. I
Yeah.
know exactly.
Exactly.
It's still a battle. Like me when I go into
In
a
fact,
farm,
it's a
I call
worse
it
battle.
yeah,
It's a
I call
worse
it a
battle
farm
because now
because
you know.
for like
No,
a
that's
week or like 2 weeks, I just can't do anything. I can't get out of bed. Thank God for my man, but I can't get out of bed. I can't do anything.
Are you clinging?
He is cleaning.
Self-identity becomes a problem.
Okay, you see what she said about OCD and ADHD, sometimes he
Yes.
does most of the things when I'm just in that zone. But I know I'm in this zone. I know I have to get myself out, but I just don't know how to get myself out. It's
Exactly.
quite a struggle. I'm like, tomorrow I have to wake up and be better. Tomorrow comes and I'm still like, nope.
You know, the thing is,
Guys.
when you're self-aware,
Yeah.
sometimes it's even worse because
Yes.
now you know, I am doing this,
Yeah.
and it's so painful. It
Yeah.
is excruciating. It's better that you don't know sometimes.
Yeah. Sometimes
Than
it's
you
better
do.
don't know.
I think we
Okay.
need a session on now
A
self-awareness.
session for
Oh, no,
with self-awareness.
self-awareness.
But guys, thank you very much for tuning in and just listening to this conversation. If you have resonated with this conversation, kindly do something. Seek support, like Dr. Zawadi has said. Seek
Yeah.
support. Make sure you get the help that is needed. A big shout out to Waithera for organizing this amazing event, organizing these sessions so that we can have these conversations that are very insightful to help us just be better and do better. Congratulations, you've done a good job.
Thank you so much. Thank you.
All right, guys. Thank you very much for watching. Time is up. This was Melissa, Dr. Zawadi, Waithera, and me, Miss Kithinchi. Thank you very much for watching. Yeah. What's up, everyone? Welcome to Mindfest 2024 edition. And right here is the live podcast session. Thank you very much for joining us. They call me super host, Miss Kithinchi. And on this particular session, my panelists, please introduce yourselves.
You go first.
Hello, everyone. My name is Marianne Mugane. I'm with the Chiromo Hospital Group, and I'm a clinical psychologist.
For sure. Hi, everyone. My name is Shaq. I go by Shaq the Youngin, aka El Shaco, however you want to address me. And I'm an entertainer. That's how I think I describe myself.
Now, on this particular session, we're going to be talking about work, and it's all the dynamics that come with work. Settling down in this environment, getting used to whatever the environment is, interacting, delivering the deliverables that you have, and all the dynamics that come with navigating work and its phases. And probably I'm going to pose the first question, or rather just interaction to you, Shako. How would you describe a healthy working environment?
A healthy work environment to me is a place that you are always looking forward to go to. Somewhere where you actually feel, comfortable with the people around you. Somewhere where you feel, that your services are appreciated. Somewhere where you feel that, even though you're spending a lot of time there, it's not all just going to waste. So that to me, I think those are the things that I look at when, I'd say that I'm happy at my place of work. Basically.
Yeah.
So somewhere where you feel appreciated and that whatever service you're offering there is actually needed. Basically, yeah. That's how I look at it.
Would you forego all that for money? Because sometimes they say money makes people happy. Would
It
you?
depends on the times, basically, when it comes to the economy. Sometimes I do understand that life actually, the different situations we find ourselves in life. And as much as we always say, sometimes you have to do what you need to do to survive, peace of mind to me is very, very, very important. So, to be honest, because having a peace of mind also goes in line with, where you are, basically, or where you've decided to work. So, sometimes it's not worth it, to be honest, because you might be working somewhere to earn a living for yourself or just for your own personal survival. But do remember you're also working for somebody if you're employed, that is. Meaning you're helping somebody, achieve their goal in, the organization or in whatever they've set up for that where you've come in. But you're foregoing your own dreams because when your mind is just heavy and, you're not really happy or at peace, you get distracted from doing other stuff that maybe is what you need to do to build yourself. So I would not forgo it, but with the tax situation that we have, sometimes I know a lot of us are, dealing with a lot in silence.
Yeah. Doc, would you advise someone to go for the money when the paycheck is good? I mean, you can always look for happiness somewhere else. Would you?
Yeah. Okay. What I would say is that sometimes people don't have a choice. Like, let's say you could be a father, a single mother. Yeah. And maybe what you have at that point in time is only what you have in terms of employment. So sometimes it's also looking at what else is available, during that phase where you are going through a difficult time. Yeah. So it's not always clear cut. Yes. It's easy to say, forgo, but what are the real circumstances that this person has?
Yeah.
Yeah.
Well, now, you see, that's where we get to people now getting used or accepting conditions that are probably not fit, or if they were given a chance, they would choose something else. But because the money is there, they take it.
Sure.
Shaq, how would you describe a toxic working environment?
Completely opposite of everything I said before.
Yeah.
You feel like, you're dragging yourself to be there all the time. You're avoiding people at your workplace. You just feel like maybe not accepted because at a workplace, I believe it should be teamwork because you're all working towards achieving a certain goal as a unit. But now, when you're part of a team and you feel like you're being sidelined, lack for or better words, maybe always on the bench. Your ideas are not appreciated, your efforts are not, the effort you're putting in is not reciprocated when it comes to the respect you receive at work, or it could be many things, even the remuneration, like she just mentioned also. So yeah, stuff like that. Somewhere where I feel like I'm living to work instead of or even just working. Okay, I believe everyone has to work to live, but where you feel you don't want to be in this place, or maybe when you're working somewhere you're still looking for more options. That's an unhappy workplace for me.
For
Because
sure.
your mind and body and, let's say, soul should actually be present at the place, like all that should be reflected in the workplace or the work that you're doing. So if you feel like any of those is a miss, to me that's when I'm just like, no, this is not working for me anymore. So I want to work for it.
Yeah. Now, Miriam, you find yourself in such an environment, very toxic,
Yeah.
but you need the money.
Yeah.
You have to stay. There is no otherwise. What are some of the things that you need to do just to make sure you take care of your mental health?
Yeah.
Yeah.
Okay, first of all, you need to look within the organization, what structures are there
Okay.
that are available. Yeah, because depending on how big the organization is, you could have different departments. Yeah, some organizations may have an employee assistance program. Yeah, I see nowadays some organizations even have psychologists in-house, right? So look at the organization and see, are there structures available, okay, to help, yeah? But also, it's important that you also have mechanisms as an individual, yeah, that help you deal outside work, yeah? So this could be, because we normally say, for any individual, whether you're in a toxic workplace or a healthy workplace, you need to have things in your life that, would they say, point to you positively, or people, yeah? So a lifestyle outside that adds positivity for you. Yeah, because if from the way he's described toxic, from your description where you're just coming in, because you said it's right opposite of being happy and appreciated on what you're doing, and when you come to work you are happy to be there. So you're imagining toxic will be the opposite, and you're there 8 hours a day. Yeah. So when you leave that environment, what are you going to? So then you have to really ensure that the other side of your life, you are on purpose, being very, would they say, calculated, yeah, about balancing that out. Yeah, it's very important. And if in the workplace that does not have those structures, okay, so it's important then to have structures outside. Yeah.
Now, Shakam, let's get more, more personal, whereby some of the things that you've mentioned, I'm sure you have experienced some,
For sure, yeah.
maybe single out one that really took a toll on your mental health and made you, and just explain to us how that thing made you feel.
Oh,
Yes.
well, I started working when I was very young, actually. I started working while I was still in high school. I was 18 years old, now in the media space and everything. And I would say just being like one of the youngest people in a certain workplace, or just being young and, just that to a lot of people at the time was very, would I say, shocking or new to them. So also just getting sidelined by people being your age or something, because a lot of people, we have to accept, judge maturity with age. So some situations you find the tasks that you're being given, you feel like you can handle a lot more, and I've been in that situation before. You feel like the challenges that you would be ready to take on, full on take on, and actually be able to give the necessary results. So that used to be a really big problem, in the beginning. Like, I remember that time, and I was just very demotivated at some point. Like, I would wake up and like you said, hours. Yes, some jobs are 8 hours a day. This somewhere I was working for, let's say, just 2 hours a day, you know, and like certain days of the week. But still, I could not take it. I felt like out of my 24 hours, these 2 hours are actually going, you know, I'm actually spending these 2 hours in a place where, like I said, very unappreciated. Whatever I came in to do, whatever my qualifications were, are not the jobs that I'm doing over there. I think most jobs, everyone knows, has a job description and knows what's needed of them. But now, in a workplace where the jobs you're given are going outside your job description, also, I feel like affects a lot of people, and I've seen, you know, that. I was strong enough to walk away because, again, I was young, and you do know, like, you know, it's a learning process, basically. So once I realized that, it was very easy to walk out of it. But in the moment and in the situation, even when you think, no matter how much money somebody is going to pay you, no matter how much money you're going to be making at the end of the month, do remember that they are paying, but your mental health is being destroyed at the same time. So why would you pay me a certain amount of money only for me to use that money to try and find a joy? You'll be basically, you know, using the money to pay for the happiness that which you deserve. So even when the cash, you know, the cash was good at that time, very good. And that's also, at the time, I decided to still stick around. But then in the long run, just those 2 hours were affecting a lot more than, you know, they should have, basically. So I've been through that situation, especially I know for young people, the belief, you know, from the generational gaps actually really affect a lot of young guys. And the respect that, you know, a lot of people accord you just for, you know, being young, I think is something that I've seen way before. It was a hard struggle, actually, and a hard fight, and I do know that people right now are also going through the same. So for me, that type of situation, and also, like she said, also just to add on, you have to look at the structures in an organization sometimes, because if the structures are all not running together, then obviously no one will be happy. Yeah, whoever is running a certain department, unajua, can I say it in Swahili? Ile mtu amekuja na stress zake anakupewa wewe. And you're both there to, you know, stuff like that's, I think, the best way I would put it. So, yeah, so I look at it.
And at what point did you now gain this confidence to actually walk away? Because I'm sure it took a while, you know, because this is something you love doing. You'd want to continue. At the same time, you're looking at the money. At what point did you decide?
Now that's also another thing which I also go back to the advice that she just gave. Obviously, you have to have things outside of your workplace that are also fueling whatever dream that you have. So I had to actually sit down. Like I said, I started when I was very young, and at the time, whatever I was doing was a very green, very new, you know, in the market or in the field that I was in, and also being done by someone young. And I knew I had an end goal, so I had to remind myself what my end goal was when I jumped into this industry. And also, I had to really realize my self-worth, because a lot of times, what people miss is not really accepting your worth. So you put up with something or, you know, a certain situation, when in real sense, sometimes just walking out of that door opens up, you know, more doors. And I usually say, if the doors won't open, I'll jump into the window as long as I'm comfortable and whatever. So yeah, I had to sit down and actually really realize who I am, you know, because sometimes you're not gonna get that that confidence instilled in you by other people. It has to start on your own. And also, whenever you're in a bad situation, you know how you feel, but only you can get yourself out of it. So I believe that was it. So, and then the confidence also comes from every day is a new day. It's never, you know, it's never too late to restart. Failing one time, I usually say failure is not, you know, failure is quitting. Failure is not, you know, you have to try again and again and again. And like I said, just having that hope that there's always something better out there. So that's how I, you know, that's how I managed to get out of that. And I've been moving like that ever since. Because the situation I'm referring to actually was, when I was 18, 19. So it made it, every workplace that I've been to, I was learning something from it. Because again, also, we're humans. Every place you are, whether you're in school, whether you're at work, whatever situation you're in, I usually feel like there's something you can pick out of it. So the more you grow, a more confidence, mindset in all these spaces. What you went through in a previous workplace, when you go to the next workplace, you know how to spot it, and you know how to deal with it, or even how to react to it. So yeah, that's how I look at it.
Yeah. So, Doc, this question is probably regarding millennials, because I feel like Gen Zs make up decisions. If it's not working, they are not reporting the next day.
out.
No resignation, no nothing. But millennials, we are known to like take our time because maybe of the money or the responsibilities. You're known, because I remember there's a time I wanted to quit some job just when I had cleared college. And my parents were telling me, don't quit before you find another job. Don't quit before you find another job. But one, I have no experience. Finding another job is quite hard. This thing is taking a toll on me. I'm almost falling into depression. I had to quit without nothing. So what would you tell someone who is in a situation whereby they love what they are doing, but the environment is toxic? They don't know what to do. Mind you, they are very young.
Yeah, I think first of all, self-awareness. First of all, if they're really struggling, is to count the costs. Because money can be earned, money can be replaced. But if, like, let's say someone is severely depressed, and they keep at that space all the time, you see, then a decision may need to be made. Because in mental health, we normally say you may be going through something like a condition, let's say depression, but the environment needs to support your recovery. Okay?
Yes.
So the way he described his experience of a toxic environment, being given jobs that are not in line with for
your-
another person, it may be toxicity, may be being undermined. Another person may be excluded from meetings. So the experiences are very different. Okay? So, just depending on what is going on, then you count the costs. Yeah? What is worth losing? Yeah.
Your peace, your mental
peace,
health,
yeah.
or the money. Yeah. Okay.
Yeah.
Now, Shak, how are you able to balance work and life? Because as an entertainer, I
Yeah.
believe have your hands on a few other things that you get to do to bring
Yeah.
money to the table. How do you balance that?
Mine is kind of funny. I live my work. My life is my work. What you see is what you get. So that's why I look at it as do something that you enjoy, something that is something that is you. So you don't have to put an act to it. So that's the thing. Most of the stuff I do, my hobbies, all revolve around the career that I've taken. So it goes in line, but there are times where I detach. And it's very easy for me to detach. Yes, I'm out there, I'm in the social scene, you'll see me online, you'll see me in different places, but when it's my alone time, it's my alone time. And a lot of the time, I prefer my alone time. That's the thing. So just always having time to myself and speaking to yourself. Because also you might find that a lot of people can be in your ear, and filtering everyone else's advice when you personally know where you want to be or what you're going through or, that type of stuff. All those voices won't help you. Like I said in the beginning, it has to come from within. So just having that balance and knowing, always reminding yourself the reason why you're doing whatever you're doing, the goal that you are, you're heading towards, that is what actually, to me, I feel like just keeps me grounded. Yeah. That's the perfect balance for me.
Yeah.
Yeah.
Miriam, for someone who has an employer who takes away all their time, they keep adding jobs. I mean, they're there, but the time is being taken by the employer. How would you advise such a person to what steps can they take so that they make sure that their work-life balance is there?
Okay. Well, work-life balance is never 50-50. That's the truth. And we have seasons where work will be more than whatever else is happening. So it depends on what is happening in this person's life.
So I'll say generally, you see. So then you, number one, maybe you may need, if it's possible, to have a conversation. Yeah? Because I'm sure, well, I hope that most places that people get contracts in terms of their working hours. Yeah? Is there a space to have a conversation about, the number of hours that you're putting in? Okay? And what can happen if you're working more? You see, because a conversation like that may make the employer realize, hey, by the way, if this person is asking me to pay more because they're spending, I'm giving them more time in the workplace, maybe I need to slow down. But you're saying something, you're putting a point across that you're asking me to put in more than, you are giving me, yeah, and more than we contracted for, yeah. But also another thing also besides that is knowing how do you reorganize if you don't have an option, yeah? So I'm going to speak of extremes, right? If you don't have an option completely, how do you reorganize that work? I'm hoping it's an employer who's not telling you I need this by tomorrow, because that one then now there's no option.
Yeah.
Okay. So if it's something that you can play around and decide you can have certain long hours at certain times, and then now you balance out your other hours out, then that is, you can manage that way. But if it's an everyday thing and you've tried a conversation with your boss and it's not working, and that is the expectation that, that is happening, check, are you able to handle that? You see, and for how long? As you now decide what do you want next for you. If this is a boss who does not, because it's true, we do have organizations where they say work ends when you leave the office. Yeah, it's not the hours that you put in. Or we have organizations they thrive in who can they get out the most. So there is also that competitiveness of, let's see who can, the employees themselves also create a culture amongst themselves of pushing themselves so hard because they want to be the one on top, right? So in such an environment also the employer will keep giving you a lot, okay? So conversation number one, see what is possible. If there is no option and you are not able to handle, maybe after if the HR department, they're not assisting. Some HR departments assist, and they are not assisting. Then you may need to reconsider and see then what else can I get that works for me. Yeah, but the conversation needs to be there. Yeah.
Now, Shako, when you decided I'm walking away, did you have a plan, or did you say I'm gonna figure it out when I'm outside, because this environment, it's a no?
Yeah, I would say I made sure to have a plan, because in this day and age, trust me, there's a lot, and if you walk into if you walk blindly, I feel like you might jeopardize yourself more than even the situation that you are in. But also, even if I did not have a plan, for me, my peace of mind has to be. It's what I take most seriously. So, yes, I did have a plan, but also in a state where there was, it was just too much to handle and there was no plan. Tunachia God. That's how. Yeah, I'm a big believer that, like I said, there's always something and there's always someone watching. And whatever you do, do it at your best. Do it with your all. That's how I look at it. So, yeah, the plan was there. Appreciated it, and the plan even ended up changing. Because plans do evolve, ideas come, different decisions are made. So yes, it's always good to have a plan. And I would say, once something starts becoming toxic, we can always tell from the beginning. And the moment you just realize, no, this is not a place for me, that's the time you need to start, just trying to figure something else out. And also give yourself enough strength to be able to be in that position as you're working on doing something else. Because, like you asked earlier, sometimes getting rid of those toxic situations is not as easy. So if you can get enough courage to just hold on as you're looking for something else, or maybe trying to think of another plan, then that would be best. Yeah. So it's not something I would advise someone to, do, which is work, just leave with any situation without a plan. But if you can, or if it's too much, like Doc said, then it is what it is. Yeah.
Doc, for someone who wants to leave and they don't have a plan, they cannot think because their mental health is in the bin at that particular moment, what would you advise probably someone who is watching and they are in such a situation?
Okay. We normally say don't make a big decision when you are not okay.
Okay.
Yeah? So we normally say go for treatment first. Because talk to someone. Because if, as you are describing, this person must be in a very bad place.
Yeah.
Okay? So you need to go see a mental health professional. Let them ascertain what's going on with you first. Right? And most probably, if someone is in that situation, the mental health professional, even when they are seeing you, can recommend some days off for you from work. Okay? So you are able to then recuperate from home, yeah? As then your mind becomes more clear, and then now you are able to think, okay, is this the right time now for me to leave? Is there another option I've not considered? Okay? Because sometimes also, which I did not mention earlier, it's very important to have mentors who help you navigate certain waters in workplaces. Some workplaces have been toxic for years, and you are coming in, so you're not going to change that culture. Okay? But when you have a mentor who perhaps even has been in a similar situation, they can advise you. Yeah? So, the important thing is don't wait for your mind to be in there.
In the bin.
Yeah. Yeah. As you notice that you're beginning to struggle and it's difficult, start finding ways of coping, talking to someone, seeing a mental health professional. Yeah. Because it's in those spaces that even you start looking and being self-aware. Am I able to handle this? And for how long? Yeah. Because another thing about going for therapy is that they also give you coping mechanisms around certain things. Like they can teach you how to ignore certain things. Okay? So if it's a boss that you see once a week, but every time you see them it's really difficult, then they show you how to navigate that. Okay? So, and that's what I was saying, you need to be aware what are the resources available to you to help you cope during and as you are trying to figure out, is exit my plan, or do I want to keep getting support as I'm trying to figure out? Because we do see people who are, in toxic environments, and as they go through therapy, they become stronger, and they're able to handle the workplace for a while until they get another space. Okay? Again, also, what is your career plan also? Okay? Is that organization offering that or not? Okay? So there are many things to consider. Many things to consider, but don't wait until your mind is, as you said, in the bin. Because that literally means you're not thinking. That means even you're not even being able to deliver at work. Yeah. So it means it's terrible. Yeah.
Also, to add on what you said about the mentors, also there's this thing where I think I learned some years back. I don't have time. I don't have time to make my own mistakes. So I learn from other people's mistakes because I learn from other people's mistakes because I choose not to have time to make them on my own. So having people, the mentors and just people who have probably been through, a similar blueprint to yours, or have taken a similar path that you're maybe looking to go towards. Having such people around actually helps a lot.
Yeah, you can use them as a blueprint.
Exactly. Yeah, use a blueprint. You know where this person went wrong. Not that you're obviously not going to make your own mistakes at some point. It's life. It happens to the best of us. But just lessening them and having minusing the times where you're sad and depressed because you made a mistake is actually also very helpful.
Yeah. All right. So as we wind up, Doc, do you have a word for, the final word when it comes to navigating work and its phases, just generally when it comes to mental health?
Yeah. So number one, you have to be aware, yeah, because the workplace and you are one environment, and you're entering into a physical environment. Yeah. So there's what you want, yeah. There's who you are, and there's what the environment is offering, and there's what the environment is. Okay. So when you're looking at the phases, is understanding where are you in terms of your career and what do you want, yeah, and is what you're doing, what is it coming together for you with what you are looking for, yeah, is there satisfaction, okay, because that's also are there challenges that help you grow, yeah, so that now you're able to analyze and say what is the benefit of this relationship I have with my workplace, right? Okay. Then there are different phases. There will be the place where you are growing. There will be the place where you feel you're not growing. There's a place that maybe you don't feel like growing because you're used to whatever you are doing. Okay. Again, it goes back to self-awareness, because we are always evolving as human beings, right? I normally say, we in life we are taught to go through life as a group. You enter standard 1 as a group, you all go to standard 2, so you are just moving as a group. So the movement is timed. Next year I'll be here. But when it comes to work, it's not necessarily the case, yeah, depending on the environment you're in and what is being offered there, and what you're looking for, yeah. So that's why I'm talking about self-awareness, yeah, being able to reflect and say, okay, is this am I feeling a sense of satisfaction here? Then what do I need to do to increase that sense of satisfaction? Sometimes it's not about the work. Sometimes it could be a few things you could tweak for yourself. I see some people going back to school when they're still working because they learn a new skill, then they come back and practice at the workplace, okay? Or sometimes they can, at the workplace, look at what else is available, what space is available, that they feel if they get into there, they will be challenged and they will grow, okay? So is understanding where are you and what is happening with you from within and what are you looking for, so that now you can figure out how to navigate into the next. And the next could be still within the organization. The next could be adding something that adds knowledge for you. Some people get even a side hustle because they are still at work. So what is it? And it starts from inside. Yeah, because the outside will not inform. It's the inside.
100%.
Yeah.
All right,
Yeah.
Shako, your final words to someone who's probably in the same situation as you, as you were? Yeah.
Well, I would say that trust your gut, because also your gut. I'm a big believer in trusting my gut, because, like I said, when we all see some red flags, a lot of people choose to ignore or choose to just stick in that situation. But as soon as you feel just your instincts tell you that you're not comfortable, you're not going to be able to perform your best at a certain situation when it comes to your work, or if you find yourself just becoming unhappy, becoming moody, even with other aspects of your life, because at the end of the day there's so many different aspects of your life, not just work alone.
Yes.
So why would you let that one thing, which is something that you can work on, in any other part of the world? It's the same thing. So yeah, I would say trust your gut as soon as as early as possible,
Yeah.
so that you avoid, because a lot of time is lost when you don't take action the moment you realize something is wrong. And I don't think any of us wants to lose time, because time is all we have on this earth.
For sure.
That's the thing. Yeah. So
Yeah.
yeah, I think that's what I can say.
All right. Thank you very much for sharing your story, Shako, and
Appreciate you.
encouraging someone who is out there wanting to
going.
make better decisions.
For sure.
Thank you so much, Miriam, for offering your professional expert advice. Asante sana.
Thank you.
All right, guys, that was it for this session as we navigate work and its faces. Thank you very much. In case you have resonated with this conversation, please make sure you make the right decision. My good name is Miss Kithinchi. Thank you for watching. Hello, everyone, and welcome to yet another episode of Mindfest right here. We are holding the sessions for the podcast, and right now we're going to be discussing about drug addiction and recovering. And joining me to discuss this topic is I'm going to let you introduce yourself.
Hello, my name is Stephen Olwach, recovering addict, drug addict. Yeah.
All right.
I don't know how else to introduce myself.
I mean, that's fine. In regards to this, that's okay.
Okay.
Yeah.
Yeah, hello, I am Diana Michelin, a counseling psychologist and a drug addiction counselor.
Yeah, all right. Welcome. My name is Miss Kithinji, and I'm going to be moderating this discussion. Now, like I mentioned, we are going to be talking about breaking the chains, understanding and then recovering from drug addiction. And Stephen Oloch here is someone who has lived with an experience of heroin addiction.
That's right.
How did you get to that point? What was your first interaction with heroin?
Interesting. My first interaction with heroin was at university, looking to find acceptance, looking to find a crew, and unfortunately, I found them in heroin. Yeah.
So is it the company or friends that you had, or how did that happen?
I think it's a culmination of more than just the company. Why are we looking for company? Feeling lonely, feeling I want to be accepted, looking for, I guess, at that age, looking to have a life. And life at varsity comes with a certain group of people.
Yeah.
Yeah, so I think that was the underlying. And then actually started out with marijuana, and then we graduated into heroin. And it felt good as well. Yeah, there was the euphoria of getting high.
Yeah.
Yeah.
So at what point did you actually realize, okay, now this is an addiction? It's no longer recreational purposes. This is an addiction.
You begin to feel it physically. You begin to obsess about it. Start to either lose sleep or have cold shivers, headaches, diarrhea. You begin to feel your body needs it. Yeah, and then you realize, okay, without it, I will not be fine.
Yeah.
And if I want to be okay, then I need to use. I think that's when really I got to figure that one out personally.
Yeah.
Yes.
Now let's get to hear from the psychologist. Diana, do you think, or rather, do you have statistics of how much peer pressure can actually lead people to engage to things or drugs or whatever it is that they do not want to due to peer pressure? Do you have statistics? Because I feel like it's not everyone who gets into peer pressure.
Per se, I would say around 98% of us, normally we find ourselves doing things because our friends are doing them and just wanting to fit in with their friends. So you just find yourself in that kind of a habit they're doing, and you don't want to look like you're the odd one out in the group.
Yeah.
Yes.
In regards, or rather in your perspective and the kind of interaction you've had with drug addicts, what age group would you say that these people get into this drug addiction?
I would say, the first thing to understand is addiction has different reasons to why it stems, but then you find most of the time a person who becomes an addict, they'll report to you that the first time they ever got into contact with the drug of their choice, either it's alcohol or marijuana or any hard drug they were using, you'll find it was most of the time in high school. That's around 15 years, the teenage years. It was the first time, that's the first time you can say this person began the addiction. Because you first use it, then you like the effect, then later on you're like, let me go and try it again because I like the effect. Yeah.
Now, Stephen has mentioned things like to fit in, loneliness. What are some of the causes that some of your patients have come, to tell you that these are the reasons as to why I got myself into this?
Okay. First of all, you'll find that addiction could be genetical. You'll find there are those families, when you look at the grandfather, the father, the brothers, there's a trend of people drinking. That one you can attribute it to these are genetical illness that is in the family. Sometimes addiction can stem from, how do we say, personalities of people, the people who are most susceptible to addictions. I would say maybe somebody who's an introvert. I'm easily susceptible to getting addicted to a drug because I'm spending most of the time by myself, and addiction comes by constant using of the drug, and eventually gets to a point where I grew tolerance to it, and now I need it more to feel the same effect I used to feel. The first ever time I used the drug, and sometimes you might find even a cheerful person also, they'll need more of the drug to feel more cheerful than they are in life. Another thing that you might find that can bring in addiction is the common stressors in life. You just want to deal with your stress in life. What we grew up knowing, or what we have always been seeing people doing. When I'm going through a bad breakup, we tell you, go and drink it off. When you're going through work-related issues, you're like, when you go back home, you drink it. You're having poor appetite, you're told, take bang, you'll get the appetite. You're going through maybe poor sleeping patterns, you're told, you go and drink, you'll sleep. So you find those are some of the things that can predispose us to this addiction. Also, some people might be having mental illnesses that are easily linked to using drugs. An example of depression. Somebody who's not aware that they have depression, they might be using, for instance, alcohol to deal with the depressive symptoms, but they don't know about it. And you find maybe sometimes also using the drug itself can also induce another mental illness to myself. So I use the drug, I get the distress, the anxiety, then at the end of the day, you hear the psychiatrist diagnosing me with another. Now I have a mental illness other than the addiction thing.
Now, Stephen, you've gotten to this point where now you are addicted, you already know this is an addiction. How was that time for you? Did you want to now let go of this situation that you're in? How easy or how hard was it? Where are you getting the money to sustain this addiction? Are you still in college? What age are you? Let us know about that.
Okay, still in college. Now chronically addicted because heroin is one of the, I think, most addictive narcotics.
Yes.
Using 2 times, 3 times a day. As Diana is saying, quantities are needing to be increased to have the same effect.
Wow, okay.
It is more expensive than a recreational or a soft drug. The pressure is on because nobody's going to give it to you for free. The drug world is hardcore. Hakuna kitu ya bure, or that's just basically life. So, hauna job. You're trying to stay in class or keep up. Front like you're actually going to class and in school. So life becomes very chaotic. Anxiety napanda, definitely. How do you buy? How do you score? You need money. So what are you gonna do? Utaanza wizi, utaanza uongo, you'll start doing anything, basically, really anything, to get the fix.
Yeah.
Okay.
How much was it going for at the time?
Okay, and this, by the way, is late 90s,
Yes.
early 2000. Okay, so it was going at what was called akikete, which could have been like maybe maybe 1 or 2 grams. I'm not too good with my measurements. Little bahasha ilikuwa inaenda at I think 150.
Yeah.
150 shillings
Back then.
back then.
Yeah.
That
That's
100
like 500 or something.
Yes, that
Yeah.
150 shillings was going. I would need to use that at least twice a day.
That's like 1,000 for a student.
Yes.
That's that this
Yeah.
day, probably now, yeah, for a
Yes.
student, yeah.
Yeah. And to stretch the high, then you'd do a cocktail. So you'd spike the marijuana joint,
Yeah.
Addicts 101,
Yeah.
with the heroin, which comes in different grades, if I can say, and that would probably stretch it out a little bit longer, just a little bit longer.
Yeah.
With a different effect. Yeah. So pretty much, you become a criminal.
Yeah.
Yeah, literally.
Wow. Diana, how long does it take to get addicted to heroin? Because, I mean, it varies from individual to individual, but approximately how long does it take?
Heroin is one of, let us say, for people to really get addicted, it depends on the type of drug you're taking.
Okay.
Heroin is categorized in the hard drug category, and you find the reason why it is easily to be addicted to heroin because it acts so fast, and the whole thing about addiction is how it affects your brain. So you find somebody would be addicted to heroin within 3 months, at least 3 months. It is so easy to be addicted to heroin. Yeah.
Stephen, is there a situation where you can remember that now really got you into a lot of problem, whether mentally, how was it? Do you remember any situation?
So what happens when you become extremely anxious because I need my fix and I don't know where I'm going to get it and I'm going to do anything to get it. So there's anxiety. And then once you get caught up in it and life becomes hopeless and I feel like I can't get out of it, then depression also kicks in.
Yes.
Okay. With the heroin and at the level I had gotten to, which was now intravenous, I was now occasionally having overdoses, an OD, which is now you're basically on the scale of life and death. You might come around, you might not. Yeah. And that happened on several occasions.
Oh.
Yes.
How were students now viewing you? Like, were they interacting with you? Did you have friends at the time?
Okay, so as I said, the group or the friends were all users.
Okay.
Yes.
So you guys did not interact with other people that were not users?
No, we didn't interact with others, and others were lituogopa. They're like a pandemic, a plague.
At that time, did you guys care about what the rest were thinking about you?
No, we didn't give about the rest. They're just mafala wa kawaida.
Yeah. They don't understand.
They don't get it.
Yeah. Wow. So now, at what point was now your turning point? What happened?
Okay, so I think got to the point where feeling like life is not worth living, and then becoming more and more reckless, using more at every opportunity with I don't want to say the intention, but in the back of your mind knowing that I might not make it out of this. It could be my last shot. And fortunately for me, I always came around. And then I realized, or I came to a realization. I like to use the scriptural reference of the prodigal son, or even what's his name, Jonah in the belly of the whale. You're in that really dark spot or place, and you realize, or you come to a realization that, you know what, this is actually crap. This is not the kind of life that I want to live, or the kind of life that I can live. I can live a better life than this. And I think that was the switch inside of me. I think it was even more spiritual than anything. That unajua nini, life doesn't have to be like this, and it can get better, and you can live and not die. And so, what do I do? Fortunately, and this I was told just not too long ago, that I think I just had a fix, and I came out, and I think my sister happened to be around, and I said to her that I really need the help, otherwise one of these days you're going to find me dead. And that was, fortunately for me, I had a family that was, even after all the drama.
So they
had
knew
seen.
what was going on.
You know what? Everybody knows you're using. You're just the one who thinks that
They
hakuna
don't
mtu anajua.
know. Okay.
But kila mtu anajua, especially those who have seen you or know you, they'll be saying something is definitely going on. You're not the same person. If you haven't used your one thing, if you've used your another, life is just basically falling to pieces. So
Yeah.
everybody knows. Tusidanganyane. Yeah.
Really?
Yeah. Kila mtu
Now,
anajua.
Diana, Stephen was lucky to have a family that was ready to support him. Some people are probably orphans, they don't have a family, they are the only ones. When you get to a point whereby you feel, I need to stop this, but I don't know how, what do you do?
In the case of an orphan or
I mean, in the case that you want to stop and you don't have support from family, what do you do? What do you do to your mental, emotional, psychological, state?
okay, it depends with what we say. It depends with where you are at life, because at times we receive clients who the family stepped back because waliona kama huyu ni nuisance kwao.
Walichoka.
Yeah, walichoka. You've been a terrorist to them, and then you find they step back. But then there's the workplace that notice this person is not okay. So you find that once you have clients who are brought in by the workplace, so you find over time that is when you try to rebuild the family relationship back. At times we normally say, in as much as you went to your addictive phase and you kind of threw off some of the good friends that we see, you normally told, though, for you to even recover, you first have to realize that you're not okay, and the strength in recovering is that part where you seek for help. So we normally tell you, if you have a friend whom you can actually tell them, actually I need help, I think where I am, I'm not okay. You'll find some friends, you'll always have that one person of all the friends that you maybe lost to during your addiction, who will be there to hold you and guide you through the recovery process. And at times we normally say, if you're not able to find all of those and you're feeling the confidential issues, at times we have those online numbers that are there, online helplines that you can reach out to them, and then from there, that is when the help can be given to you again. Yeah, the first thing is just seeking for that help. You recognize you have a problem or you're going through something, and the strength that you need is to seek out, reach out. Yeah.
Stephen, what did you do now to get over this whole situation and get back on your feet, and how long did that take?
Okay, it's an ongoing. Yes, it's not a once and for all.
Hold on. How long did you consume it?
Okay, I think it was almost a decade.
Almost 10 years.
Almost 10 years.
Aha.
Yeah, yes.
So
I
it's
think
still
about
an
7,
ongoing
yeah,
process up until today.
Yes, the reason I say that is because I still have to watch myself. Okay, I still sometimes have to fight an urge. Okay, things is happening in life, and I'm now having to deal with life sober. Before, I could go and get a hit or a fix, or even people smoke cigarettes, people smoke, people drink, and that kind of helps them cope. Okay, but I know for me, I cannot go down that road again, but just because I've stopped using, my drug of choice doesn't mean that I still could not slip into a depression, or I'm still not anxious about stuff, or I'm still not lonely. Life goes on. So it is an everyday, really. That journey does not end. I think it will only end when I drop dead. And life doesn't get any easier, at least from my experience. The more people I've actually allowed into my life, and as I grow with more responsibility, stresses of life snapanda.
Diana, what would you like to say now to someone who has already started the recovery journey and they are hoping not to relapse? What are some of the steps or precautions they would take so that they make sure they don't go back to where they were?
First of all, I'd like to say that relapsing is still part of the journey. Just like we say about your mental health. The days you wake up and you're just okay, then the days you wake up and your moods are not okay. The same way recovery is. The days you might find yourself you're doing well for a period of time, then at time you might find yourself sleeping. It's part of the recovery. You only need to understand what was that thing that you didn't pick that triggered you and sent you back into a sleeping state. And secondly, from whatever you've asked, I'd say the whole thing about recovery, just like Mr. Steven has said, it's a one day at a time thing. You wake up today and you intentionally choose, I'm going to stay sober. And if it's in very intense situations, you have to tell yourself 1 hour at a time. I have to finish this hour, I have to finish the next hour when I'm sober. The thing about recovery is you need to be intentional about changing your lifestyle. It's a whole twist. When you're going to stay sober, it means I'm going to even cut off some of my friends who we were actively using with, and that means I need to find another support. If I cut all my friends off, I will be lonely, and loneliness is another trigger to using my drug. So it means in as much as I'm trying to cut off some of my drinking friends, some of my drug-using friends, it means I need to seek out for support. That is why the support could come in, the Alcoholic Anonymous, the Narcotic Anonymous, because that is where you're going to find people who are on the same journey as you. Other thing you say is at this point now you start focusing more on your mental health. You get to do the journaling of your day. How was your day? What triggered you along the way? What got you angry? We tell you take care of your physical health again. Have a routine exercise that you're doing. You get to eat well, because part of recovery is when you're in active addiction, you're not eating well. You kind of neglected your physical health. So we are telling you, in as much as you're going to recover, you need to now incorporate a good meal plan for yourself, and you need to also observe the times, because even with the hunger part of it, hunger itself is a trigger. So you don't need to wait until you're hungry. That's when you're going to look for food. And when you're eating, you also eat something that is balanced food for the minerals for your body to work. Also, we normally say, do your regular psychiatric checkups, regular psychological visits with your doctors or psychiatrists, because that is when they get to do your checkup. They can tell you you're doing well, or at this point I can feel, in as much as you're saying you're faring on well, but I can see physically not okay. So you find the way we do them with diabetes and everything, remember you go for the checkups, the same way you do for your mental health, you go for those checkups. And then recovery, just as a whole thing, everyone will get those times that they're falling down. Remember, falling down is just part of the recovery process. You find a way of picking yourself up and you move on. And you also have a strong support system. In addiction, in an active addiction phase, you'd find you don't really have friends who will be there to support you. But when you're recovering, we normally encourage people, be intentional with the people you're going to invite in your life at this point, so that you know when I'm going through a depressive phase, or I'm feeling my moods are not okay today, I know I can call Diana to tell them, Diana, they are not feeling okay, can we meet and talk? Like I'm building a support system for myself. At this point, normally say recovery is selfish. You have to be selfish. So whatever you're going to do, you have to do it for your own benefit. When it comes to friendship and everything else.
Diana. All right. Stephen, as we wind up, please say something to someone who's in the same situation you were before they started their recovery journey, and someone who is in the same situation as you are right now.
Okay. If you are actively using now, or you're in the thick of things, the addiction itself. I would like to encourage you to honestly look within yourself and figure out whether the life you're living now is how you want to live, or would you like to live better, for lack of another way of saying it. And if the answer, and I believe the answer would be from experience, I would want to live a better life. I don't want to be a slave. I want to be free. Then just be honest with yourself. Make a decision within yourself. And once you've made that decision, then put it into action. Start to seek the help. Speak to somebody and find a way better. Find a better way. And if you are off the blocks like I am, running the marathon, you got to keep checking that clock, that timer, how long have you run, how fast have you run, where am I in the journey, I'm now at a hill, I'm on the downhill. Just be very aware of where you are. And I think like any athlete, any champion, it is everyday discipline, and discipline meaning doing what you even don't want to do, but you need to do it. There's a whole life out there. If I may be a little bit spiritual, as long as you've got a spirit in you which is alive and the life in you, then it means that the spirit itself has got purpose for you. And I've been hearing about the creator and the creation. If the creator has given you life, then one way to be grateful or thankful, kushukuru Mungu, or the creator, is, appreciate it and just give it your best.
Okay.
You owe it to the boss and to yourself, and life gets so much better.
For
by the
sure.
way, it's like taking it's like taking the sunglasses off. I see people wearing sunglasses in the night. Unless they are those ones that are, what do you call it, infrared.
Okay.
It's like take the sunglasses off and just see how bright life can be. There's hope. There's always hope. It's not a hopeless situation.
I mean, they say the body is the temple of God, so we get to take care of it like the Creator would want, for sure.
Yes.
You said it.
Thank you, Stephen. We hope and pray that you keep up choosing the better life.
I try.
Yes.
Yeah.
All right. Thank you, Diana, for bringing your expertise here and just contributing to how we can balance on, just drug addiction and recovery. All right. Thank you very much, guys, for watching this session whereby we were trying to understand how do you identify when you are depressed, when you are addicted, and how do you get to recover the best way possible. Thank you very much for watching. My good name is Miss Kithinji. I was joined by Diana and Stephen. Thank you.
Hello, everyone. Welcome to Mindfest 2024 edition, and this is the live podcast session. With me here, I'm joined by, okay, let me give you guys the chance to introduce yourself, do yourself justice.
Definitely,
Yes.
ladies
Yeah.
first.
Oh, thank you for that. My name is Kate Modoni. I am a clinical psychologist at Chiromo Hospital Group, and also I am a wellness therapist. Yeah.
My name is Brian Mbunde. I'm an influencer, former radio presenter, and most of the time, I'm a marketer.
And my name is Miss Kithinji. I'm going to be moderating this session. Today's, or rather now, the topic of discussion is the digital effects on mental health.
Yes.
And how do we detox? Yeah. Now, since I got to know Brian like a decade ago, he's not that old, but miaka ni mingi kidogo.
Oh dear.
You've been online,
Yes.
and that's where I've known you to be. That's probably it's been your office for the longest time.
Yes.
When it started and right now, what would you say is the difference in how content was being perceived in public, or how keyboard warriors were reacting that time? What's the comparison, and what would you like to say about that?
I would honestly say that things have gotten worse.
Worse?
Yes. Because way back, guys were sensitive in terms of knowing, okay, this is someone that you can easily bump into the streets. This is someone that you can go for a job interview and you find there among the panelists. But right now, people have gotten the courage to just spew basically nonsense about people that they don't know, people they've never met. So people sometimes are more courageous, and the lack of respect has caused fights, and even people actually literally pulling up technically to beat up the other person from the other end. And politically, it has helped in terms of people now having the courage to talk nonsense when a member of parliament or even a governor or even just a leader, even in churches, if someone says something that you're not comfortable with, sometimes it helps. But sadly, the lack of respect has gotten to a point where guys just don't care. They'll just spew what comes first to mind and just reveal who they truly are.
Yeah.
Yes.
On a scale of 1 to 10, on both negatives and positives, how helpful has the digital platform been, and how dangerous has, or rather destructive has it been?
It's been very helpful in terms of getting, okay, this let me put it like a 10. There are so many guys who focus mainly on just being influencers, guys who literally their daily bread is going out there, showing up, creating content with various brands, or just living their lifestyle with the brand in it. So I can wake up, I shower using, let's say, Cassons. Toothbrush is by a different brand like Oral-B or something. Toothpaste is from a certain brand. Breakfast is, let's say, a Java. So literally their lives is pegged around the different brands. So many guys have now become influencers on that side. Way back, we just knew celebrities as influencers. So a singer or actor, those used to be the main influencers. But right now, anyone can be an influencer because you're literally influencing your circle around. Remember when we were growing up, and guys used to say, Mama Kithinji utumianga Omo. Sa mi nitatumia Omo instead of, let's say, Sunlight. So your mom technically was an influencer in her circle and even in Chamas. So just like that, now everyone is an influencer, especially if they're using social media. Sadly, social media has become a platform in terms of cyberbullying. It's been so huge because now so many guys are able to know, okay, this person has posted that they're at this location. So let's go on ground and let's say bully them or even hound them when they're there. Some clubs or even restaurants, people have been paid to go and tarnish their names. So you might have a legit business, but there's someone who's been paid to go and tarnish that business out there. Yes, and most of the times it's just little money. It could be even 500 bob, and someone goes and does like over 10 videos about how bad your brand is. And right now everyone is literally struggling. So you have even other competitors who are paying the other businesses to now go and tarnish your business out there on social media. Yeah.
Let's hear from the psychologist. Muthoni, do you have statistics of patients who've come to you, and when you narrow down the cause of their depression
or whatever they are going through, the cause is social media? Do you have statistics?
Well, we have worldwide statistics.
Okay.
I'll start off with that. The global statistics, Nielsen Company did a study, 2023, and they revealed that the average adult, 25 and above, actually 18 and above, spends around 11 hours a day on social media. 11 hours.
Yeah.
And we have 24 hours in a day. So look at the 11 hours. Is it from your 8 to 5 p.m.? And that is why we're struggling with work-life balance.
Yeah.
So University of Pennsylvania, they did a study because social media is now a focus as around the mental wellness fraternity. It's now a focus per se because it's an addictive. It's made way to behavioral addiction, and there's now a lot of research that is being funded to go into getting the key statistics. But currently we just have numbers which are not yet quantified or peer reviewed, so I can't really say them, but we have the average adult spends around 11 hours a day on social media, and we have 100 million messages worldwide sent on WhatsApp per day.
Yeah.
So that is a daily mass communication platform on WhatsApp, because almost everybody in the world is on WhatsApp. And one of the things that University of Pennsylvania revealed was that we have a lot of spike in depressive episodes, anxiety episodes, or other disorders just from use of and consumption of social media. Yeah, there's a way that it's interacting with us. And in my practice, I've come across young individuals as young as 12, as young as 9. I remember one case stood out, little young person, because a 9-year-old, we call them pre-tween, like they're not even a teenager, from around 10 to 12 basically. And she had gotten online and she had seen something that was quite grotesque, an image of, a live image of, the wars that are happening currently. And she couldn't sleep because she started having so much fear. She needed to see a professional. Yeah, it had affected her. And that is just one of the very many unique cases that have stood out. The other ones are lack of sleep. An individual has poor sleeping patterns. And one of the things that is what we consider a red flag in clinical setup is lack of sleep, or that one of the things that is greatly affected, that is a primary executive function, is lack of sleep or sleep issues. So when it starts with sleep issues, it has a ripple effect to the whole well-being of that person, up and including physical productivity and activity. So it is here currently. I have seen it in Kenya from my buddies whom we practice with, and my own experience, and also now the heavy research that is being carried out worldwide, Africa, and also in Kenya.
Yeah. I'm telling you, there's a time I used to sleep at 3 a.m. There were months, probably even years, that I used to sleep at 3 a.m. and I was basically on the phone. Yes, maybe I could be consuming information that could be giving me new information, but that was unhealthy. Until I made the decision of, I need to get back to sleeping at 10 a.m. Do you feel the use, because I've seen a lot of information online, the use of cell phones before you go to sleep, the use of cell phones, the first thing you do wake up in the morning is pick your phone. How does that affect someone, especially in their day-to-day life?
Well, I'll go directly into it. We had a group of techies around a week ago. And this is one of the area of focus we were talking about, mainly because of two things. We have the physiological issues that cropped up, and psychological. So let me start with the physiological. Your phone has rays that are concurrent to the rays that the sun produces during the course of the day. It's called UV light. And that is why we have phone features that have blue light, to sort of counter that. But it's not quite effective per se, because you still have to have some level of light when you're interacting with your phone. The dark mode is not so dark.
It's not.
Yeah, it's not so dark. So even the littlest of light does something. It, for lack of a better word, it oxidizes the hormone, which is very sensitive. a very sensitive key hormone that is produced that initiates sleep-wake cycle. Now, scientifically, if you do not sleep within the hours of, the most crucial hours that you ought to be sleeping is from 10 p.m. to 2 a.m., according to something called the circadian rhythm, sleep-wake cycle. So during this time, the brain shuts down. That hormone initiates the production of other hormones and neurotransmitters that help you service your brain and your body. Blood is cleaned. When you wake up, you have your kidneys have cleaned your system, your liver, the excretory system has done its work. But just because we have this particular light, this hormone was never produced. And that is why when you kesha, for lack of a better word, you go the whole night without sleeping, you will experience 3 days worth of accumulated fatigue. Yeah. So lack of sleep leads to issues of the brain. Sometimes studies reveal that the brain cells start swelling, and that is a very key roadmap to you starting to hear voices. You see things that others can't see. You see a shadow by the corner of your eye. For lack of a better word, we call that hallucinations. So it is very easy to become psychotic. And the mother of all that leads us there, the gateway, is lack of sleep and what it does to your brain. Sleep is so significant to even the way your heart beats, to even the way you carry out your physical now activities. You will feel winded, tired. Your heart will struggle because it wasn't serviced. We are very keen to take our vehicles for servicing. Yeah. But are you keen to let your brain be serviced? So physiological, blue light and the UV, the eyes, you'll start noticing that I used to read my calendar, the one you have draped on your wall or the one that is next to the TV. I used to see the days and the dates, but now I'm squinting a little bit. So constant exposure to that light does a lot, it interacts a lot with your eyes, and that is why a lot of IT individuals, a lot of people who are behind a screen, all of them, after some time.
Yeah, they have glasses.
They do have glasses.
Yeah.
So just that, you have to take care of your physical and your mental, because both of them are married.
For sure.
Yeah.
Brian, I don't know if you've heard this from creatives where they say they operate best at night.
Yeah.
They are creative at night. There's nothing you can tell them. If anything, you call a creative before 10 a.m., they are definitely asleep.
Yes.
Do you know what works? What's that? Have you heard of that?
I've worked in advertising initially, and for most creatives, I think that's when your brain is just focused on major ideas. The night shift beat especially is when you're able to track those ideas, because that's when literally you've encountered so much during the day. So now is when you're settling down, and that's when I think everything is able to be processed quite fast. But also the other creatives who prefer sleeping, going to bed, and waking up, let's say, between 3 to 5. Remember, even when you're in high school, there are guys in boarding schools who used to now wake up early to study. So for some, time wanashika kabisa.
Yeah.
But it really depends with yourself.
Yeah. From a psychologist's point of view, do you think it makes sense?
Well, we have things that have been embedded in us, and we take it with like a bitter pill, that this is the time, we've heard it, this is the time that my brain is more, productive, but really no. That is the time when you do not have a lot of sensational or other sensual input, like it's quiet, everyone is quiet. That is the time when there is not a lot of noise around you. So basically they're chasing the silence, that the hustle and the bustle of the daytime does not allow you, because sometimes some people would need total silence to be in their creative knack, but ideally it's counterproductive, because down the road the individual will experience a mental block, a creative block.
Yes, we do.
Yeah, you hit a block and you're like, why is this wall there? You can literally even taste the wall, even you can know the cement that was used to you know, to make that wall up and all that. But it's counter because it will have an effect later on during the, you know, at some point it will catch up with you.
It will.
Yeah.
Brian, is there any point that, especially when you are starting off now, being that social media guru, you have this number of followers, was there at any point that you felt this pressure to live a certain way, especially being a man, looking at maybe your classmates that you went to school with, doing these big things? Did it ever get into you?
So many times, even today.
Oh, okay.
You know, I think especially for men, FOMO always catches up with you. Because let's say like right now, you're here having a session, then you go to Instagram, you see guys have gone on road trips, guys are in coast, some guys are celebrating graduations.
But there's this weekend you find that everyone is in coast, you're like, guys, you didn't give me the memo.
I'm in a car group and guys usually say, kwani wewe ni sufuria unabaki ndani ya nyumba?
Oh my God.
Hata sufuria saizi imeenda kwa matanga ama wedding. At least toka kwa nyumba, toka kwa nyumba. So the FOMO literally kills you, and for me, I think one thing that I usually try most of the time is I push myself to that limit for FOMO. So on New Year's, I always stay indoors, always, like 99% of the time. So when guys are doing 3, 2, 1, I mean me doze mbaya. So I usually wake up, tuko next year? Okay, yes, I'm good. Yes, I try, because I know, especially with New Year's, usually New Year's Eve, usually get that pressure. Oh my God, what ifs? There's also this phenomenon that I discovered online that so many people usually face, but ni chini ya maji. Birthdays. There's that fear that anything can happen on your birthday. Like there's actually I think it's a cult of following. People usually feel that on my birthday, I might get into an accident.
What?
I might die.
I've never heard of that.
Actually, even dying is actually like top. Yes, there are people who just have a FOMO that I have to stay indoors. I'm sadly one of those people. I prefer staying indoors on my birthday because I always know gari hiyo ndo siku taa itabust. No matter what, umetoka service, hiyo siku ndo kitu, things will just go haywire. Yeah, and it happens.
My birthday is in November 21st. Oh my! I start celebrating my birthday 1st November, the whole month.
Yes. Sasa on your birthday, just stay indoors.
Come on, guys.
But it's just all in your head.
Yeah.
Yes, because for me, I think it's more of some people, especially based on reading online, you see stories where people maybe sadly committed suicide on their birthdays. So it's just a random feeling that you get.
Yeah. Kathleen, what are some of the, effects that really come from now these digital platforms and digital influence? What are some of those effects that we most probably don't even know?
I'll do you one good. There was a research that was peer-reviewed that revealed that when someone misplaces their phone and they touch their pockets and they miss their phone from their pockets, the shock that you encounter is equivalent to a mini anxiety attack. You almost have an anxiety attack.
That's me.
Like it can floor you.
Yeah.
So it's equated to that because it does a lot. Because you feel like an electricity current. And I've seen you're using a certain phone, so I know. Do you have insurance for your phone, by the way?
Yeah, I am planning to because
can I chime in? Because I think last night I had a dream like that. I dreamt.
I
swear. I dreamt that I went out. Then kidogo. Simu iko wapi? And sadly it was like Inception. So it was a dream inside a dream. So I tried waking up to confirm if I still have my phone. So sadly, I had to confirm, oh my God, kando ya pillow and everything. So it actually hits you hard, especially as an influencer. You're skeptic that, maybe Suku log out. Yes. Yes, you're scared someone might do crazy things on your account or just call everyone and say, hi, Bunde, nataka M-Pesa, si tumetuka kitu hapa. Then especially if you remember that you're an influencer and you have all these followers, so guys will definitely believe you. So imagine convincing all these people.
It's hard.
Yeah, it is hard. Someone accidentally went online and did something and it costed them their job, you know?
Yeah.
And but the effects are that, the mini panic attack,
Yes.
That one does a number on your body. That shock, it does quite a number on your body. There's the aspect of isolation. On a number of occasions, because of the lockdown when we were in during Rona period, a lot of guys developed social anxiety disorder, pure outright. And I had symptoms of social anxiety because I had gotten used to masking up, and now I have to take off my mask. But now people had gotten used to having online conversations. Now we have to establish human conversations again. So social anxiety always peeps, and then we have depressive episodes because of FOMO. My friend went and rented out a Mercedes or an Audi, and I'm looking at my Vitz, and it's looking like, a horse waiting for me out there, you can't even relate. They're getting Audis, and I'm here with my little thingy, and also the aspect of, friendships breaking, the quality, we call them quality relationships. So you also have misunderstandings. Miscommunication is also one of the downsides. There is a way I will say something virtually, and if you are present with me, you'll be able to get my social cues. But when we are one-on-one, you'll be able to get the social cues, and you'll know what I mean. But when it's purely virtual, you'll not be able to see that I'm twitching, and then it's the live, I'm maybe holding my stress ball and all that. So a lot of tics might come out, and social connectedness is interfered with, and basically people will shut down. Those are the downsides. However, there are positives, that social media is a platform for learning. It's a platform for connecting, supporting. One of the things that stood out during Rona was for maybe some things like support groups like AA. We saw AA moving to the virtual space, and individuals who are being treated for or were in treatment for addiction issues, they're able to keep track and keep touching one another. But for us to even talk about detoxing, it means that we have had a little bit of too much. Like the cup is literally overflowing, and what started off as something very good and beneficial is now causing more harm than good. Too much of something is poison. So detox, we need to detox because it is now impairing, it is now seeping into boundaries and places that it ought not to. It's like overeating. You eat too much and your tummy is literally telling you like, yo girl, how are you gonna sleep tonight? You're gonna look for lemon and a packet of Eno because you ain't gonna sleep. I'm too full for good. Food is not bad, but too much food will make you slag. You'll feel some type of way. It will have issues. So we'll detox when now that thing that was very useful has started having more harm than good.
So as we wind up, Brian, someone who is in the same space as you, I mean, we are all on social media, but some consume more than the others. How would you advise them to balance?
As she had mentioned, regularly perform digital detox. Sadly, I'm part of the people who are very addicted to our phones. I remember, sadly, during 25th June, during the Mandamano, when network went down, and so many of my friends are literally, because I was with so many of my friends at that period when the network went down, and so many guys were checking their phones.
Now, how can a VPN?
Because some of their friends are saying, maybe the Safaricom, ama the Airtel, ama the network gani, ama the iPhone ndo ifanyi. Watu wa Android, simu haifanyi. Because I remember so many guys were trying to restart their phones, nothing is working. Washa PS tuone, nothing is working. TV, jaribu kuangalia Wi-Fi, nothing is working. Zima stima turudishe, nothing is working. So many guys had so much anxiety during that period. Among those guys who, at 3 a.m., I'll send you a TikTok. I need to stop doing that, yes. A TikTok, not even one TikTok, like 10, back to back. And when you wake up, I'll still send others. So in your head, you're like, umsal lala sangapi. So you need to learn how to take a break regularly. And even when you're hanging out with friends, with family, especially this December as it comes, try and be that person who's in the moment. Si kila saa uko, hebu chape selfie, hebu acha turekodi kuku, hebu acha tupige sijui nini, hebu acha tu-upload saizi. Try to be that person who's part. Okay, it's good to document stuff because sometimes you never know, it might be the last time you're celebrating with someone. Chukua picha uweke simu kando. It's okay. It's not documenting kila kitu. Autengenezi documentary, relax. And chances are very high you won't even use that video. Because I'm that type of person. Tunachilingi tu hivi kidogo kidogo napata alert kwa Google Photos. On this day in 2010 ulikuwa nafanya hivi. Yes. And it's something that I definitely forgot about. So document kidogo kidogo si kila kitu. It's okay. Also in terms of as an influencer, try and be that person who does things for good versus negatively. Because at the end of the day, guys will always remember you. My first digital campaign was in around 2011, 2012, Kenyans for Kenya, where we brought guys together. Guys were donating cash and also in kind, and food was sent all the way to sides of Turkana. So it's literally guys just using social media for good. Even during the protests, guys are sending posters in terms of just communicating among groups. Okay, this and this is happening, or take care, get home safe, or this and this is happening in this area, avoid that route. So it's literally just using social media for good. Try and definitely use it for good. In terms of things to avoid, try to be your brother's keeper at the end of the day, because I've been in situations where sadly someone may be passed on and you help their family. You've never even met those guys, and in terms of how you feel, how you've impacted someone, definitely it goes a long way. Si kila mtu atasema, okay, of course the guys will go online and say, mtu ni mtu wa forex, nini, but in real sense, it's things that you did kidogo kidogo in terms of helping someone, and just, yes, life just literally works out for you. So at the end of the day, just do the small things that, si ati unataka reward, ati shika trophy, you did something. Things will definitely just work out for you if you're that person.
Kathleen, your last words as we wind up, and also just tell us from a psychologist's point of view or a medical point of view, how do you detox when social media has really gotten into you and your mental health is on the bin?
I'd just like to share 3 to 4 points. The first one I'd like to share is be realistic. If your work also involves being online, you have to be realistic. We normally use something called the Eisenhower matrix. You tend to what is very urgent, what is very important, something that has a clear set deadline, and then something that has a blurry deadline. It's very urgent but not important at that time. You sort of schedule it. And then there are things you sort of delegate, and then the final quadrant is, delete distractions. So be realistic. Am I needed online right now? Do I need to answer my emails right now? The second thing is set limits. Have time for yourself. People do not respect themselves in this particular manner. You choose to write emails and go over your emails when you're eating or when you're supposed to be having lunch. Feeding and or rather fueling your body is as sacred as fueling your car. There are certain things you normally oversee when you're fueling up or rather filling up your tank. Your car, for example, doesn't need to be on when you're fueling up your tank, just in case. So if you're very keen to take care of machines, if you're very keen not to pick up your phone when it's charging and talk on the phone with it, what about you? So set limits. Have boundaries. When I have visitors, let me be a bit courteous. When I'm out for a social event, there is a reason why we chose to meet physically. So be realistic. If your work is online, plan accordingly, set limits, honor what needs to be done at that particular time, and if it's other people, accommodate them, and also respect yourself as well. Set limits also for the time you're supposed to be sleeping. Actually, statistics indicate that you ought not to use your phone 2 hours to your bedtime.
Yes.
Yeah, 2 hours to your bedtime. We are having people walking around with raccoon eyes and panda vision because, the dark circles, evidence of a night hard online. Yeah.
And sleeping with the phone next to your bed or even on your
It's not
bed, and
okay.
some sleeping with their phone or in their hands.
Well, those must be
I
single
healed.
people.
Nani
Thank
atama-
God.
nani
Those are
atamaliza hiyo
single
TikTok?
people. No, those are single people. Anyway,
Yeah.
single people just chilling. I'm so sorry you're catching strays. I'm so sorry. And then the last, or the second last,
Yeah.
is to avoid distractions. You don't have to have your notifications sliding on your phone or having, nowadays, we have phones, smartwatches. Hey, those ones. Nowadays, you can even answer calls, pick calls.
Yes.
Yeah, he's guilty.
We have
I've seen
it.
you.
Mhm.
So you are in a very important meeting, but zoop, zoop. So you even start wondering, you've left that meeting, and it's quite crucial. And then the other thing he's talked about is abstinence. You can pick a day. I know some of us might have a heart attack, outright, but you can pick a day to go phoneless. That is what we call device detox. Pick a day to go phoneless. I know for you, I don't know, is that a foreseeable
Something.
future goal that you can do? I don't know, he will use smoke signals that day to communicate, but
Or maybe schedule posts.
yeah,
Then,
yeah. So that at least you can have time with yourself.
Yeah.
Because right now we have people who do not know how to spend time with themselves. If I'm in a crowded place, I would rather be on my phone to manage my anxiety, because I don't want to go and interact with people I have no business interacting with.
It's very sad.
Yeah. So there is that abstinence, days of abstinence, and then there is the social media detox, a specific app detox. There are now apps that locks other social media apps, and they prevent you from interacting. You said maybe 20 minutes a day. I want to spend time on this app for 20 minutes a day. And if it's up, it locks itself. I have a friend who did that, and she was so frustrated she uninstalled that security feature that was helping her manage her time.
Oh God.
So it happens, but when you get to a point that it's quite impulsive and you're compelled to constantly be online, you posted a picture 2 hours ago and you want to see how many likes are there, it means you have a problem.
Yeah.
You have to stop and smell, the roses, spend time with yourself. You're ignoring yourself. Yeah. So
Alright.
basically my parting shot is tufunguke.
Yeah.
Also tell your buddies, notify them that I'm not going to be online, or I'm doing something, I will not be available this time. You don't even need to tell them why. Don't go into the nitty-gritties of why you're going to be offline. But you do it for your own mental wellness, to spend time with yourself, to cook that meal, to have fun with yourself, to take that deep shower. That is self-care, and it's so freeing. Yeah. When you
I
get
wanted
there,
to smile because I take my phone with me to the bathroom because I want to listen to music.
girl, you need
Same.
to see me after this. Yo, I have clients. You got to see me after this. Tutaongea nyama. Like, yo.
Sawa, next time tutabeba Bluetooth speaker.
Well, when you're na shock, what if the phone fell inside the water, even if it's waterproof?
Hiyo ni shida ya siku ingine.
Oh my God. Yeah, but let's be mindful.
Yeah.
Yeah, let's mind our minds.
Yes.
Yeah.
All right, guys. This was very catchy, very interesting. Thank you for being amazing panelists and sharing your story and your expertise.
Thank you so
Asanteni
much.
sana. All right, guys. Thank you for joining us as we talk about the digital effects on our mental health and how we can detox. I hope you guys have learned something. I believe you and me might have a problem when it comes to how we consume the digital space. So if we can do a better job, at it, the better for us and better for our health. That brings us to the end of our sessions, the podcast live right here at the Mindfest 2024 edition. That was our time, and I hope you got to learn a lot from this day's event. My good name is Miss Kithinji. I was your moderator, and I was joined by Kathleen, our psychologist, and Brian right here, our social media influencer. My good name is Miss Kithinji. Thank you so much for watching.